Welcome to the Mob Jazz podcast. Please be aware that the content of this podcast is primarily social commentary and represents the personal opinions of the hosts and guests. It is not intended to be a statement of fact or an official stance on any issues discussed. This podcast is for entertainment and informational purposes only. We encourage listeners to seek out professional advice for any factual matters or decisions. Listener discretion is advised. Ask me if I have an icebreaker, and I don't know if I think this is apt because we have a doctor on the pod, right?
Okay.
When I was in P5 or P4, I told you guys my dad didn't let me watch TV, so I used to read a lot. Not because I liked reading, because I was bored. So I read Gifted Hands by Ben Carson.
This is where we are starting from.
Listen, I said I'm going to be a neurosurgeon.
Yeah.
Not a doctor.
A neurosurgeon.
A neurosurgeon.
Yeah.
Not a doctor.
Those are the nerves guys, right?
The what?
Oh, the brain.
Brain,
right?
brain,
brain.
nerves.
The brain.
Brain and nerves.
Okay.
Yeah.
Oh.
I was like, what do you mean? Like, I read Gifted Hands. I was so inspired, guys. I cried. After Gifted Hands, I read Think Big. Mind you, I'm 9 at the
Right,
time.
why were you reading?
What were you doing? We were reading
Child.
Peter and Jane.
Can I say, as a doctor, I never read those books.
Really?
That's what I was doing when I was in P5.
And this is how you're going to see why things turned out the way they turned out. So I read these books. I'm so touched. I cried as like, guys, this has shaped who I'm going to be. I took my first chemistry exam when I joined like high school. Like beginning, I got 29%.
Okay, you passed. Congratulations.
Out of 100. Don't be rude.
Yeah.
Anyway,
If I tell you what I got.
so I was like, and then I said, I sat down and I thought, I don't think I like the medicine. I think I like the book. Hence, I'm a lawyer now, but guys, I promise you, when I was 9 years old, you could not tell me I was not going to be. Mind you, I didn't know any neurologist in Uganda at the time.
I don't think many
Were there any?
9-year-olds
I don't think there
knew.
were any.
Yeah. Even if there was, I don't think 9-year-olds. That's information that 9-year-olds would
I
have.
had access to it, right?
Yeah.
And also, let me not pretend like I was so serious. After reading it, I'd go and watch like Robot Boy. So let me not
Yeah.
act like
I won't lie, that book did not move me.
Which one? Gifted Hands. The story of his plight and
Wait,
his
was it the one
mom's
of separating the twins?
I didn't read it.
Yes,
I
he
don't
talked
read it.
about separating the twins. Like he was, I think, one of like the first doctors to separate conjoined
Yeah.
twins, and their brains were joined as well. That's why he was called in.
Yeah, for me it was like
And
a
they
movie.
both survived. Guys, it was so touching.
You know, my attention span in P5, I could not read a book that long. I could
Actually,
not.
I don't think I read the book. I
I
think
used
I
to
watched the
borrow.
movie.
You guys remember how we had like, what was the subject where I would borrow books from the library and then write like summaries?
Literature?
Was a subject.
English.
It was a subject.
Wasn't it
In
English?
KPS, it was a subject.
Comprehension.
I can't remember what it was, but I remember I used to get books from the library and we have to write.
Don't tell me you'd
That's
pick
what
books
I
with
want.
pictures. What
No,
would you
I would
write?
pick books.
I know the thing you're talking about because we also used to do it.
Read the first like few pages,
And the last.
fail to read the rest of them. On the day when we're supposed to hand that homework in,
Mm.
just go to the back of the book and just make stuff
blurb.
up. Like read the blurb and come up with something and I'll submit that.
I won't lie.
They didn't
Yeah,
really. Yeah, I don't think they really cared. Yeah, I
The
don't
books I
think
used to borrow were like Animorphs, Famous Five.
from the library.
Oh,
Yeah.
like
Yeah.
the Nancy Drews and whatnot. No, but I told you this is what I was reading for enjoyment. I wasn't allowed to watch TV. Like in a week, I watched probably like
So let me
3
understand.
hours of TV.
You sat down at your age
I wasn't
and read
allowed.
Ben Carson for
I wasn't
enjoyment.
allowed out of the house to play because I was a girl and my dad believed they would kidnap me.
Fair enough. All of us.
They were kidnapping kids.
It was
in
mob.
Colombia at that
So
time.
it was
Yeah.
fair.
To be fair.
They
They
were.
were.
Wasn't that the time when they also used to like pierce boys' ears?
Yeah.
So they don't.
So
Yeah.
I wasn't allowed to go out to play with people and I wasn't allowed to watch TV. I promise you, you would read Ben Carson.
Ben Carson.
Don't even, you would. I was so bored.
Like for enjoyment.
That's actually kind of a sad way to
No,
start.
but it makes sense because you're a lawyer and you like reading.
Yeah.
Yeah, I guess.
Yeah.
Yeah.
But guys, I was so touched. And then right now, when I found out like the type of person he is now and his beliefs and his political whatever,
Yeah.
I do not like him right now as an
Yeah.
adult.
I remember
Not
that
aligned.
controversy, but what was it?
Or that he was a
Just
Republican and whatnot.
Super far right.
Yes.
Super.
He tried to run for
He did.
President.
Yeah, he
Yeah,
did.
I think that was his big.
Oh, he's
Yeah.
far right.
Yeah.
He exposed himself.
Man.
Yeah, it wasn't cute, bro. It was not cute.
But yeah, his story was so touching.
He still did something great, I won't
He
lie.
really did.
Yeah.
He did.
I think he was the first doctor actually
To do
to
what?
separate conjoined twins, if I'm not mistaken.
Like via like the brain, eh?
Mm.
I'm not sure. I don't remember.
I think it was the first, and it also took about 12 hours, was it?
Yeah,
some
I
some
remember,
jazz
yeah.
like that.
Yeah.
I won't lie, I would
Sounds
never
about
read that for enjoyment. I think I watched the movie. I don't think I read it.
Did you go to Johns Hopkins?
Did he?
Yeah.
Yes, he did.
So that's what I wanted to go to Johns Hopkins. But just because I heard that he did, I didn't read the book. That was my only, and he was a black doctor. You know,
Yeah.
there are not many black
Yeah.
doctors,
Yeah.
surgeons.
Yeah.
Yeah.
I think it was actually so painful. Like, he used to be like this pillar.
In
Like,
the
I was
black
"He was, man, the
community.
first black." And then they met him
Yeah.
and he was very like
Super
not
conservative.
super pro-black,
Yeah.
man. It felt funny. It felt
That's
funny
crazy.
during the campaigns.
I won't lie, I was probably watching, what's that thing with the wardrobe?
Which one?
Read Chronicles of Narnia. That's probably what I
That
was
was
reading.
Nice book. I like
Yeah.
that. That's
Yeah.
why
Ben
I
Castle?
was- that's why
I don't know.
perfect.
Yeah.
I didn't read Chronicles of Narnia.
You didn't read it, but did you watch it?
No.
Up to now?
You didn't?
I
I feel
think
like
you
you
should watch
should.
it.
You should.
You guys know I haven't read or watched Harry Potter, right?
Yeah, you told us.
You haven't read or watched Harry Potter?
First of all, they jam you to watch Harry Potter because of witchcraft. And you didn't watch Chronicles of Narnia, which is the exact opposite.
But now you have free will. Why
That's
haven't
a
you?
witch.
What was what?
That's a witch.
Yeah,
It does.
but
What has a Witch
does.
Chronicles?
Yeah.
Yeah, for sure.
I just know that they used to enter like a cupboard
Closet.
or something, or closet
Yeah.
or something, and there was a big lion.
And a
Yeah.
witch.
they used to
Mind the
roar in the
wardrobe.
movies.
I
man.
love
that
that
jazz was
lion.
glorious when I was a child.
I love
What
that
used
lion.
to-
I might need
the
to
lion
rewatch
used to
that show.
speak.
Yeah.
Aslan, is it? I think that's the name.
Yeah.
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 We used to talk.
I didn't.
I think also the books were by C.S. Lewis, if I
Mm-hmm.
remember.
I cannot remember.
And the lion was like a representation of like Christ. That's what I
Of what?
remember.
Yes. But I think I learned that later on. I was just.
So did I. I learned this when I was
just-
like 18.
Yeah. I learned
When
the
I was a child, that was
representation
just
of what?
adventure.
Christ. Like it was a Christ. It was like a Christian.
Yeah, that's what I'm saying. It's the opposite of Harry
Yeah.
Potter.
Really?
Yeah.
I know nothing about this book.
I mean, the villains were different depending on the book because there were like 4 books. But yeah, it was written by C.S. Lewis, who is also like a Christian author.
Bro, my
Do you know
attention
any of
span as
that
a child,
jazz?
I
I
don't
won't lie.
remember any.
Any
I don't
Even
remember.
movies.
I don't remember the details. I remember the lion. I remember the kids. I remember them coming through a closet. I do not remember what the movie was about.
Yes.
I remember
all.
everything.
Same.
Yeah.
I remember
At all.
everything.
I remember highlights.
To be fair,
I should
okay,
watch that.
it depends. I remember the first one well. The others?
When they're saying Chronicles of Narnia is similar to Percy Jackson, is Percy Jackson not about
Not at
Greek
all.
mythology?
Yeah. Percy Jackson is
Isn't
so
Percy
different.
supposed to be like he's like a son of Poseidon or something like that?
Yeah. To be fair, they are all based on, what is it? Deities, in a way. So maybe that's why.
I can't remember, bro. But welcome back to the Mob Jazz podcast. Man. I'm Melvin,
Sydney.
Casper.
and today we are joined by
Amanda.
Doctor.
Thank you. Dr. Amanda.
Yeah, man. So
If-
today,
As well, let me just say, if as a
Uh-huh.
doctor, you'll be.
oh, you guys
sick
would
of
hate me.
You'd be.
What would we call that? Dr. Mob Jazz podcast.
Yeah, like
Yeah.
as in,
Could not permit that in any way.
Literally.
and
To
even
be a
and
doctor in
then
front of everything.
everything in life, like
Yeah.
even when I'm just like let's say I'm taking like my child to school,
Yeah.
and someone says, "Oh, I'm so and so." Oh yeah, I'm so and so's mother, doctor, this and this.
Yeah.
Like that would be.
You know what? You wouldn't, because I'm the actual opposite.
Uh-huh.
I'm the, like, I hate when people
Saying it.
Okay, I don't mind if you guys call me doctor,
Yeah.
but I'd rather you didn't. Like, you don't have to, unless I'm your doctor.
Okay.
Like, unless we're in the
Oh.
hospital
Okay.
and I'm there in the capacity as your doctor, then you can call me doctor. If we're just out and about, like, I'm just
What does your
Just
name tag
Amanda.
have?
Dr. Amanda, but because I'm in the hospital. Yeah.
But
Otherwise-
don't you feel like I automatically, anytime, like let's say I'm around like certain people, like doctor, engineer, in my mind I'd be thinking, so how does it feel to know you're the smartest person in the room?
Isn't it?
No, but are
Like-
you?
Aren't you?
Are you? No, like, I'm smart
Low-key.
in medicine.
By
I
the
don't
end
know
of
if I'm that smart in other things.
If you're smart
I don't know
in
anything
one of
about
the
law.
hardest things in the world,
You're smart in
you're
other
smart. That's like,
Let me
See
tell you.
the video clip of the Minister of Finance
Uh-huh.
at, I think, like a press conference or something.
Yeah.
uh-huh.
And there was a professor who was standing in front, and I guess the minister wanted to speak or something.
And he told the professor to
Professor
sit
told
down.
him, yeah, the professor said, I'm a professor.
So-
I'm higher than you.
He said, "But you don't tell me to sit down. You sit down
Yeah.
like this."
That's energy I need to have.
I was like, by the end of this pod, you will confirm that you're the smartest. Don't worry.
Literal. Do you have
Sure.
your stethoscope in like your car, hanged in your car?
I have it in my bag.
I've seen doctors that
Yeah.
hang them on the driver's mirror, like a stethoscope.
Is
I
that
don't know.
not saying "call me doctor"?
Yeah.
Literally.
But
Or like
I
have you
also
seen the
know
number plates?
Yeah.
So some of my colleagues when we graduated,
Yeah.
they got like doctor on
on
their
the number
So-
plate.
Yeah.
That's kind of.
I was too shy. Like
Hey,
first
yo,
year as a
that's mob.
doctor, I was
Yeah.
like, no,
That's
let me
mob, I
first
won't
see.
lie.
Let me first see.
Now
So-
I think it's well earned. Like
Let me
you've
ask.
toiled,
Yeah.
you've suffered, you've.
When a
whatever
doctor
you
gets a
So would you put
PhD,
counsel?
That's so ill.
What-
When
Yeah, and
people,
counsel
when
is-
lawyers call
Thanks.
each other cancer,
Counsel is not as fly.
Thanks.
I feel like
Yeah,
I
it's
want to
not as fly.
disintegrate and die.
Yeah.
I hate it so much.
Yeah.
When I remember when we had first joined LDC first week, cancel. It's the first week of the
Yeah.
back.
but you are counsel.
Do doctors
No.
do that in med school? Call each
Call
other
themselves
doctor?
No.
Not at all.
Although these new, sorry, I don't know why I'm doing this. The new,
We took with our hands, by the way,
Yeah.
on this pod. Yeah.
the new young doctors,
The Gen Zs of
the Gen Zs of
Yeah.
medicine,
Yeah.
they be calling themselves doctor.
Doctor in school.
I
In
feel like
medical
it's like
school.
a fun thing. I would do it.
Nah.
Okay.
I would do it.
Nah.
You wouldn't.
I'm like, let me first get there.
Yeah.
Let me tell you, if I study for a thing, you're going to call me by that thing.
Oh yeah, on that one front. Listen, if I was just like, I don't even know like the amount of effort that goes into each specialty, but like I feel like there are those that we've been taught to treat as like super serious, right? So like,
Yeah.
if you hear neurologist, when I got migraines, when my migraines intensified last year, and I went to see a neurologist, and I found out his dad had been like the only neurologist in Uganda, and now he's also a neurologist. I was just like,
That's nice.
what are you guys made of? And then like his brother is a judge, Supreme Court judge or
So
something.
now us who have nothing. What do you
giving
call
Jesus
us?
as a carpenter.
Man.
Like, I pass this down to you. My
like-
father trained me.
Then anyway, so I was like, if I was like neurologist, cardiologist, like things that seem super, super complicated,
Yeah.
Uh-huh.
you're calling me doctor. Like it's my name, MD, everywhere I sign.
Every day.
Yeah.
Yeah.
Fair.
Fair enough. When a doctor gets a PhD, what are they now? Is it
MD,
still doctor?
PhD.
There's still, MD. You just add more things to the end of your name. So the beginning of your name doesn't really matter. It's just now the number of letters you have at the end. That's where you.
I be
that's where
seeing
your
doctors
flex
with more
comes.
letters.
MD,
Yes,
More
can
letters.
study.
Fellowship of words, masters, PhD.
And me with my bachelor's. What? No.
Listen.
Bachelor for real, I won't lie.
kill me.
Yeah, man. So welcome to the pod.
Thank you.
We're really glad to have you.
Thanks.
I think before we start, maybe you should just introduce yourself to the audience. Just
Okay.
let them know who you are, what you do, and then we can get into it.
Okay.
Yeah.
So my name is Dr. Amanda. I'm a medical doctor. I'm a cardiologist by training. And I trained in the UK, but came back now 6 months ago just to work at home. I've never worked at home, haven't really lived at home for a long time, so I just wanted to get that experience and see whether this is where I want to pursue my career. Also opened a wellness clinic 2 years ago called Revive Wellness. And the reason behind that was to build a community of people who are more health conscious and provide services that are professional but a bit more informal for people who are scared of going to the hospital or scared of doctors, just to give them exposure to different ways that they can think about their health, screen, and also activities that they can do to improve their health.
Nice.
So yeah,
Nice,
that's me.
nice.
Right?
Yeah, you're on a health pod, man. Your posture can't be-
Yeah. Oh, my fault. My fault. No, this pod has been a long time coming.
Yeah.
I think we mentioned that before you came on. Since maybe I'll say like the second half of last year into this year, we've been wanting to do a like health focused episode at least.
Okay.
So we're really, really glad to have you. I have a lot of questions to ask. Yeah, man, where do we begin? I want to start with Revive actually.
Yeah.
Yeah.
You said that it's
Wellness.
yeah, it's wellness, and you're trying to give guys like something that feels different from a hospital.
Yeah.
I remember when I was growing up, like if I was sick and I went to the hospital, I always felt sicker.
That's what a lot of people say. Like,
What?
during COVID,
Yeah.
they'll say, oh, I had COVID, or their relative had COVID, they went to the hospital, then they got worse. And there's that idea that every time someone goes to the hospital, they get worse or they die. Which is a bit counterintuitive because most people will wait until they're really sick, right, before they go to the hospital. by the time they get to the hospital, they'll have all of the complications, which means that they are less likely to survive, or they're probably going to get sicker while they're there. So I think people's perception is that maybe if I had stayed home, I would have been fine. Probably not. But the fact that they waited so long to go to hospital means that they missed the boat of some intervention or reversal of whatever was going on, because they were afraid of that initial finding out what's wrong with them. And I think that's a very common thing with people, where they don't want to go to hospital because they're like, oh, I don't find out what's wrong with me. I would rather not know. But by not knowing, you're delaying any possible way of reversing whatever might be wrong with you at that time.
How about if, because I tell the boys that I'm the opposite of a hypochondriac. You know how a hypochondriac always thinks they're sicker than they actually are? I always think I'm less sick than I really am. Like, unless I'm on the verge of something is finishing me, I will pay it no mind. Like, I don't know if it's a last one thing. Like, I don't want to ever be like, I think I grew up not wanting to be there, and people think like I'm faking it for attention or something like that. So,
like, you want to show resilience.
Yes, I'm just like, it's just a headache. Okay. It's just
Interesting.
okay. I'm chilling. Like, the first time I got COVID, I said, like, on Monday, there's a way I'm feeling a bit weak, but I stayed going to work.
Yeah.
I worked until Friday, Monday to Friday. The whole week I'd been feeling lethargic, headaches, dizziness, and I'm like, whatever. Mind you, the job that I had at the time, I was working with people. Like, I used to interview people every single day. They would come to the office, we interview them, very many people. I could see like 30 people a day. I was like, no, this is just something light. By Friday, I walked into the hospital and like almost collapsed. I couldn't walk. But I was just like,
Fair enough. I don't remember last time I went to hospital. And I think mentally, I'm just like, I'm not sick. I'm not sick.
So maybe I'm tired.
But you also can't lie to the doctor that you've been sick this long. I remember the time I tried to lie to my dentist. It's like, hey, how long has this tooth been like this? I was like 2 weeks now. I said, are you sure?
But I think
I was like,
I think that it's rotten beyond a certain. He's like, this is not 2 weeks.
Yeah. I mean, you can lie, but it's not to your benefit to lie.
You be lying because you're ashamed.
Yeah.
Like I've been sick this long and
you didn't
I've
say
not
anything?
come. Then the doctor looks at you like, they're judging
I
me,
just
man.
always think that it's not as bad as, like, I'm just like, no. Like, by the time I'm walking, I'm talking, I'm going to work, I'm living life, it can't be that bad. That's always what I think.
Do you feel like you're in tune with your body? Like, you know when you're good, or you know when you're...
That's the thing. I
Not
always
okay?
know when something is off.
Okay.
Like, immediately, I'll feel like, I don't feel okay. Like, I feel like right now, I've just gotten better from a cold. But as of Monday last week, I started feeling off. Like, I started feeling a bit achy. I'm like, something feels wrong. I remember checking like the period app. I'm like, okay, it's not that.
Yeah.
Something feels off. So by Thursday, when I had the cold, it's like, oh, okay. But yeah, you see. So I never want to be in a situation where I start feeling off and then I run to the hospital and it's a cold. It's like, no.
But
Oh, man, colds be slapping.
like things. So, I think if it's something like a cold or something short-lived, like a short-lived illness, right? Or like you think I might have malaria. Let me just see a couple of days, but like check if you have malaria. If you have a cold, like things will usually manifest themselves. The short illnesses will manifest themselves within a couple of days, and you can figure out what's wrong. But it's that thing where you know you've been a bit off, or like climbing stairs has become a bit harder, but then you keep pushing it off. And it can be a very gradual thing. And sometimes either you're in denial, you're like, oh no, maybe I've gained a bit of weight so I can't go up the stairs, or maybe
I'm older.
I'm a bit older so my knees hurt, but then you're only 30 so it doesn't make sense. Like, so for those kind of things, what I would usually advise, so you don't feel like you're being too dramatic, like just get a screening. Like just go get into a habit of going to check even when you don't feel like you're sick. And that's what most people are not used to doing. They'll say, okay, I feel fine, so I don't need to check anything. But then you'll never know, okay, what was my baseline when I was okay? If you're only going to check when you're sick, you don't know, like, what are my vital signs when I'm feeling okay?
Yeah.
So you know when you're sick, you're like, okay, my blood pressure is usually like 110, maybe it's on the slightly lower side, but now I'm sick and it's 90. That's bad. That's a big difference. Or you know where your starting point is.
Yeah.
And then also, there's feeling well. You can feel well with a lot of things like diabetes, high blood pressure. You can feel absolutely fine for a long time, or just okay for a very long time before those things start to show themselves, which is why I think screening at a much younger age than you think is really important.
What's that age?
Like mid-20s.
Crazy.
And I would say that for anyone
Fast, man.
in young Africans, early to mid-20s, actually, I would say is when you just go check your blood pressure. It's such a simple thing. Or buy a blood pressure machine. It's like 100,000.
I want to check it in like secret.
Yeah.
Check it in secret
As
at home.
My boys can't know I have high blood pressure.
It's okay, they don't have to know.
That's really interesting.
That's too
Buy
funny.
it, check it at home.
But so I'm curious, what kind of services does Revive offer? Like in terms of the clinic,
Yeah.
what can I go to get at Revive? So if I'm sick, can I go to Revive, or is that only like for screening?
So typically we do screening and prevention.
Okay.
But if you're sick, we'll still come and see you and then refer you wherever is appropriate. But our thing is screening and prevention and lifestyle change. So we have two parts of Revive. There's the clinic and then there's the studio. The clinic offers consultations. So we have wellness consultations where we'll do things like health screening for diabetes, high blood pressure, obesity, high cholesterol, those things that we call lifestyle-related illnesses, where if you detect them early when you're young, you can change your lifestyle. In most cases, they're reversible. In some cases, you might need to go on medication, but then alongside lifestyle, you may not need to be on as much medication as if you didn't do it. So there's a wellness clinics, we have nutrition clinics, we have mental health clinics, and the idea is that when you're thinking about your health, it's not only your physical health or like the health related to doctors and nurses, etc. There's also your mental health, and that can directly affect how you interact with health services and also your actual health condition. So stress, depression can make your health conditions worse. Having stress and depression might make it hard for you to follow a good diet or exercise. So we encourage you to see a lot of different people in a multidisciplinary team. So to see a dietitian, to see a mental health professional, to see a doctor, maybe a personal trainer. So you're addressing all of those things in a holistic way because they are all interrelated. So those are the kind of services that you can get at the clinic. We also have a menopause clinic, which might sound a bit off, but as in off-brand, but it's management of menopause because every single woman at some point is going to go through menopause, right? So why not understand what the menopause process is? But then we also know that you can actually prevent or improve the symptoms of menopause by adopting a healthy lifestyle earlier on. So changing your diet, making sure you're exercising, increasing your muscle mass. So knowing, being able to anticipate what you're going to go through in menopause and then changing your lifestyle beforehand makes that whole transition into menopause a lot easier. So that's the purpose of us having the menopause clinic. Then we also have IVs, so IV treatments, so IV vitamins. So the idea behind IV vitamins is that, a lot of people will take your oral vitamins, either the tablets or the chewable ones, and
When they have flu.
Huh?
When they
Yeah,
have
because I don't remember last time I took a vitamin.
When they have
bro.
to. Some
they
people
have flu,
just, or some people, over 40 people start doing a lot of things.
My dad has those vitamins.
Yeah,
Is
so they
it?
take vitamins every day. They might take it every day. Multivitamin just to keep up your vitamin levels. So in the same way that they do that, we actually know that when you take it as a tablet or oral form, you only get around 40% of those vitamins that you're taking. When you take it intravenously or through a drip, you get 100% of it, and it works a lot faster. So instead of taking a pill every day, you can come get a drip, and that will take you through the month. Those are B vitamins, vitamin C, magnesium, all those things that you get in your
multivit. Take you for
multivit.
like how long?
It can take a month.
A month.
Yeah.
Okay.
Interesting.
Or longer, depending on how your lifestyle is in between. So if you're someone who's fairly healthy in between, then we might extend that to every 2 months. If you're someone who has a very busy lifestyle, so maybe your diet isn't great and you need some supplementation, then you can have it up to every month.
That's what I wanted to ask.
Yeah.
Like, so can someone not attain like the requisite amount, like the amount of vitamins and such nutrients that they should be ingesting? Can they not attain it from like diet, like from
They
fruits
can.
and veggies and the like?
Yeah. So many people can. Most people can, but there's some people who can't for different reasons. So it might be a lifestyle related issue, as in you're just very busy at work. You don't have time to eat properly. You're going through a very stressful period where maybe you'll skip meals. Not encouraged, but that just might be the phase of life that you're in at the time, and you need some supplementation to get you through that phase. It might be that you have a condition which means that you don't absorb through your gut properly. So that's things like gastritis, IBD, IBS, irritable bowel syndrome. Yeah.
I was just
That's
going to
what
go with
you're
it
gonna
like,
say. Or inflammatory bowel disease. So basically inflammation of the gut or any irritation of the gut, which means that you can't absorb the food that you take orally properly. That means that you may need some supplementation, and doing that intravenously means that you don't have to worry about your gut absorption. You can do it directly through your veins. Or if you're sick, if you have vomiting, malaria, you're tired, you're trying to recover, that kind of thing, that this is where the IVs really help.
Okay.
Yeah.
Interesting.
Have you guys had you Sydney and Melvin? Have you guys like tested for like diabetes, high blood pressure?
I've never ever got
I
a
have.
screening for anything.
I have.
Yeah, like, you
only
never
get-
checked your blood
I
pressure?
only get blood pressure tests when I'm sick and I'm at the hospital.
Okay.
I've never had like high blood pressure or anything like that in those screenings.
That's good.
I
I don't
found
know.
out that when you're
How often should I? Yeah.
that I think high blood pressure and diabetes have a correlation with your eyesight.
Yes.
Interesting.
Is it? Yeah, they do. They do.
She's a
That one I know.
doctor.
She's a doctor.
Yeah,
Lucky.
lucky.
Nah, she was
Gifted
gifted
hands.
hands. Gifted hands. She was just
So every time I go in to get my eyes tested,
Yeah.
like especially when you're going to have operations on your eyes, they have to check like your high blood pressure as well as your eye pressure. And also diabetes can directly affect your ability to
because I know
see.
it's like blood vision and stuff like that.
Yeah.
For
Yeah. So there are even like I remember there were patients that would come in like while you're waiting to go have surgery. There are those that would come in, the diabetes patients where it's affecting their eyesight, they'd have injections right into their eye. I don't know what it's supposed to do, but like it's mandatory. Like before you even the optometrist or the ophthalmologist rather would always be like, have they done your high blood pressure? Have they done your diabetes? I was like, there's a correlation. He was like, there's a very serious correlation. Like
Yeah.
we need to make sure it's not that.
injection into the eye.
Yes.
What if I blink?
No, you're as in
No.
I think they know what they're doing.
thousands of years of medicine and they haven't thought about what if it
And even if you blink, what's the worst that's going to happen? Like, you're
It
not going to
shifts
break
like
that.
so.
No, they use like some sort of metal clamps
Yeah.
to hold
The
like,
eyelid.
the
open.
eyelid.
Yeah.
Yeah.
And then they just
So like I can't even shift my eye.
what do you mean?
can.
Or like
I
move your
imagine-
eye with a needle.
Yeah.
No?
But
Okay,
then
I
also
imagine if the needle's coming to my eye, I'm going to roll my eyes back. You have to inject my eye rolled
no,
back.
No, so they'll
numb
numb your
it.
eye
Yeah.
also,
Okay.
and then they'll hold it open.
I think also the numbing, because they first put eye drops,
Uh-huh.
and the eye drops like temporarily take away your vision.
Is
They say
it?
darkness.
Okay, so I can't see the needle.
So, but
coming.
then the numbing,
that would scare
the
me.
numbing solution, at least at the hospital I went to, the numbing solution is not very strong. So it takes you to the drops. So they add something else via an injection, a stronger type of anesthesia, I think, of local anesthesia. So by the time they're putting in the medicine, you can't feel or see anything with that eye, at least for some
Yeah,
time.
see, you have to numb me because you're not going to tell me you're going to put like Novocaine in my eye.
No, but then also,
And I stay
as
normal.
you're trying to fight and whatever, please remember they're bringing a needle near your eye. Is this the time for you to be moving?
But it's reflex.
As it
It
Yeah.
could be. I think they also come from. Anyway, they have their ways of doing it.
Yeah, no,
It's
like.
been done safely.
I know, right? Yeah,
I figure.
Multiple
I figure.
times.
I'm jazzing out of ignorance, man. I won't lie.
Yeah, so I want to talk about, because our demo is mostly, I'll say 18 to like 35.
35, 36.
But since
Shout
you're
out to the
cardiologist-
40-year-olds.
Yeah,
They always be
and
like, we
bro,
forget them.
Oh.
we have like
see you.
4 40-year-olds.
And like 160-year-old.
Yeah. No,
Who
but
is
we have
it? My mom.
yeah. Your mom. A few people in other demos. And also I told my mom about this episode. She said she's going to watch this.
Okay.
So,
Yeah.
shout out, mommy. But I want to talk about now just heart disease in people our age.
Yeah.
Maybe not even. First of all, I don't even know what heart disease is.
Okay.
But let's just say heart issues
Yeah.
in people our age.
Particularly hot.
Yeah, heart, because she's a cardiologist.
Yeah,
Yeah.
fair.
Yeah.
what has been your experience working here for the past
I think
6 months?
can we first start? Is
Huh?
high blood pressure, I'm assuming, is it considered a condition of the heart?
Yes, it's a
Okay.
condition of the heart and the vessels
Ah.
leading in and out of the
blood
heart.
vessels. Okay.
Yeah, because I think that's something that I think I first had a friend with high blood pressure when we were 17.
That kind
Like
of,
that's
it just
really-
picks you, man.
Actually
Yeah.
diagnosed with high blood pressure
At
at
17.
got on medication at 17.
Yeah.
Wow.
Yeah.
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 That
So
one
that's-
picks your own, like, I think same with like diabetes, type 1.
Diabetes, yeah, type 1
Yeah.
gets you when you're young.
Yeah.
Type 2, typically when you're older. But we're also seeing it happening in a lot younger people for reasons that are not very clear.
Okay.
And so, okay, going back to heart disease. So what's heart disease? Heart disease is anything from things like high blood pressure. Diabetes is a more like systemic disease, but also affects the heart. So it's issues with the heart muscle. So, everyone, the heart is a muscle. The heart as a muscle has different functions, right? So taking blood into the heart, taking blood out of the heart into the rest of your body. Issues with the valves. So valves basically determine movement from one side of the heart to the other. And if you have issues with the valves, it can also affect the way your heart functions, affects how you circulate blood around your body. So the main issues for you, and then you have also conduction issues, so electricity. So there's pump and electricity. So your pump, you think of your heart as a pump and as an organ that generates a pulse, right? So your pulse is an electric current going through your body. So your heart as a pump is a muscle. Your heart as electricity
conductor.
as a conductor
Yeah.
is your pulse, right? And you can
Yeah.
have, as in most people will know that their pulse is regular. So you count 1, 2, 3. It's a regular pulse. That's a normal pulse. Sometimes the conduction of electricity through your heart that generates that pulse can be disturbed. So you can be slower, it can be faster, it can be irregular. And those are also different conditions that are to do with your heart. So you can either be a pump issue or a conduction issue of the heart or a structural issue of the heart that you might be born with or you develop later on in life. So in summary, those are the different issues that you can have with your heart.
That could be heart disease.
Those are all characterized
disease
as
or
heart disease.
Crazy.
Yeah, so
Okay.
it's a lot. It's very broad.
Okay.
For young people, commonly you'd say the conduction issues. So people will say, "Oh, I have palpitations, I fainted," that kind of thing. That's usually commonly in young people. So that could be conduction problems, but it could also be structural problems with the heart. The way the heart developed when they were growing up, that's abnormal. That they may not have detected at a younger age, that then starts to manifest itself later on in life. And that commonly presents as things like palpitations, fainting, sometimes pain, chest pain, those kind of things. But those are if it's structural, it will be a very obvious, like this person is sick, right? So they'll automatically go to the hospital, get checked, they'll find something wrong with them. The things that I described that are like insidious, so like slowly progressive and you don't really know, they'll start quietly and you won't really know what's wrong with you. Those are things like high blood pressure. So like your friend who had high blood pressure when she was 17 or he was 17, that can go undetected for a while, especially if it's just borderline or it might be high. But as a young person, your body compensates for those things very well. So you might feel fine until you're not fine, if that makes sense.
Yeah.
So the thing that I've found, you asked me about my experience having worked here I've actually only worked for the last month or so.
Okay.
I've been doing projects for the last 6 months.
Okay.
But working in hospitals here, what's been striking is a level of complications from high blood pressure, which complications you would have gotten from having high blood pressure for like 10 years, right? And these are in
As a young person.
20-year-old, yeah.
Okay.
20-year-olds. So the way you're describing high blood pressure affecting your eyes. So the way that it affects your eyes is that it affects the small vessels first, the small blood vessels. So the pressure, it's high blood pressure just in the name, it's causing pressure on those small blood vessels and causing damage to the small blood vessels. So where do the small blood vessels go? They go to your eye, they go to your kidneys, they go to...
Those are the capillaries.
Again,
The
hold on.
answer.
Hey, kind
Hold
of
on.
introduction
I
to
don't know why I was
biology.
shocked, but
Yeah.
No one in the group chat told me we were preparing for this pod. Like,
I told you to study.
guys
Let me
are
tell you.
educated on this topic, bro. I can't believe this. What?
Yeah.
Okay.
I know
did their
some things.
homework
I know some
before.
things.
Okay. Fair.
Correct.
Yeah.
So the capillaries, so the small, so the ones that supply your kidneys, your eyes. So those are the main. So you call it target organ damage when blood pressure affects different parts of your body. So commonly the eyes, because those are the ones that have small blood vessels that supply it. Your kidneys, they have small blood vessels that supply it. Your brain has small blood vessels that supply it, and your heart itself. So imagine having high blood pressure for a long time, damage to those blood vessels over a long period of time. You start getting eye problems, you start getting kidney disease at a young age if you've had it for a long time undetected, which is why I keep saying the screening thing, it's good to know early and treat it early so you don't get those complications. So for example, I saw someone who was late 20s, early 30s, already on dialysis because their kidneys had gone from
Because of high blood pressure.
Yes.
Going undetected.
Gone undetected for a long time. They show up, by the time they turn up, their kidneys are already off. They may have already had, some damage to their heart. So your heart, because it's a muscle, it's working harder against that blood pressure. The muscle grows, your heart becomes very thick. It doesn't function as well. So they already had those, that's called hypertensive heart disease. They already had that. They had damage to the now they started to get damage to the larger blood vessels, which is really dangerous because imagine if you damage a big artery, you can bleed out and die. So sorry, sounds very dramatic, but that was the most striking thing for me, seeing in the last few weeks, seeing young people already at that stage with their high blood pressure that hadn't been detected or hadn't been treated. So yeah, that's been very sobering for me, and also again really emphasized or affirmed to me why trying to screen and trying to educate people as much as possible is really important at a young age. So actually this audience, even though they might think that they're too
Young
young,
and healthy,
they're the perfect audience to hear this now and just be aware, not be scared, but just be aware and mindful and not afraid to go and check, because by checking you can actually prevent worse things from happening later.
But can I reverse it?
Yes.
Yeah, how there's pre-diabetes. Is there
No, if I already have high blood pressure, can I now
can you reverse it? That's a good question. So it depends what has caused the blood pressure. So sometimes it's like we call it essential blood pressure, where there's no actual cause. You just have maybe slightly stiffened arteries. The way you're born, you have high blood pressure. In that case, usually lifestyle things can help reverse it. So if you're slightly overweight, that's not going to help. It will make things worse. So losing weight actually takes points off your blood pressure. Having other things like diabetes can make your blood pressure worse. So improving your diabetes control, improving your cholesterol control will improve your blood pressure. Exercising improves how well your heart contracts, improves the contractility of your blood vessels. It will help with your blood pressure. So doing all of these things will help. But if you have a certain condition that's not reversible, so if you're born with a condition that's not treatable, where you're going to have high blood pressure forever, all you can do is try and control it with lifestyle and medication. But in many cases, your blood pressure is directly related to your lifestyle, in which case you can actually reverse it. And things like smoking is maybe the worst thing you can do for your body in terms of your blood pressure. And everyone thinks, in those cigarettes. What warnings do you see? Do you see anything about your blood pressure?
No,
a black lung, man.
You just see black lungs, right?
I think the law that was passed was that they were supposed to warn about cancer. I don't think they said all the diseases, because it's mandatory for them to put the advert that's supposed to cover 65% of the park.
Yeah.
But they just chose cancer.
They should. I mean, guys, those ads look scary.
But then how many would you see just looking at them as they're smoking?
Right?
I don't think it's
scare
made
me.
that who does it? They scare the non-smokers. They don't scare the smokers. But my point was, aside from them, I don't think that tactic being very efficient, it has a lot more effects on your body than just your lungs. So it directly affects your blood vessels, again causing things like high blood pressure. and it's one of the biggest risk factors for heart disease.
How?
How? You look stressed.
For me, I want to know if
No.
it's only cigarettes. Like, does this apply
Yeah, like
to
us want to know
vaping? Does it
what
apply to
thing.
weed?
The
Does-
thing I had, because I
Yes.
was about to ask you this actually. I heard someone say the blood vessels of smokers, like smokers, are brittle. They said that like
Like they can
they're
easily
almost like
bust.
glass.
Cigarette smokers.
They become
Smokers in
so you know
general.
blood vessels are supposed to be like soft,
Okay.
right? They're soft, like they accommodate blood going in and out, blah
Yes.
blah blah, pulsatile, all of
Yeah.
that. So in smokers, they become stiff. They become like a tube.
How? Why?
And that's the direct
your
effect
body?
of the inside. Yeah, so you just imagine instead of having those soft tubes that are
Becomes
moving,
actually-
they become like a
Wow.
hard tube, and they also become fragile.
okay.
So in that tube being hard, so you're more likely to stop blood flow from going through well, and then damage the blood vessels as the blood is going through, especially because it's not stretching. So you're not getting that, you're not accommodating different pressures. So then you get high blood pressure because whatever pressure is going through that tube,
Yeah.
it's not expanding. It's just going to keep the same pressure, and that pressure will be high.
I can see how it works. Like, you know, when you bend a straw,
Mm-hmm.
the thing stops moving. So for the blood to move, you have to push it. Like, say it's a straw and you're like sipping something. That's how I interpret it.
Is it the soot from the smoke? Or is
Yes,
it
so it's from the smoke. There's the whole, so it's directly from the smoke. Then you get these, it's called oxidative stress. You know, you talk about antioxidants are supposed to help you. So
yeah.
that stress also affects the blood vessels. So it's the direct effect of smoking, not just cigarettes, but it's any smoke. And that's
Oh,
a
it's
good,
any
that's a good
smoke.
question. It's any smoke. Cigarette smoke is bad because it has a lot of other,
The tobacco of it all,
yes,
the
it has
nicotine and-
tobacco, it has other things in it that are not great.
So even like a
But
dangerous
the
car.
fact sorry?
A dangerous car.
Like, we're talking about smoke, like,
Yeah.
But also
vaping,
environmental
blah, blah, blah.
smoke.
Yeah, that's
like
what I mean.
environmental smoke is very dangerous. So people who, I know there's been a lot of talk about changing the type of burners that people use at home to cook, right?
Yeah.
Outside. So instead of using charcoal, instead of using wood that are very high smoke generators, people are getting lung disease, but they're also getting heart disease from that smoke exposure. So I know there's been talk about bioethanol. I don't think that's reached Uganda yet, although it should. But bioethanol doesn't produce that level, that carbon monoxide type of smoke. So that carbon monoxide is what's generated when you light up.
That's
Different
interesting.
things.
So, like,
Yeah.
people who work on, like, say, construction sites are, like, more at risk. Is that smoke even?
Or in factories or in
Factory smoke,
Construction
construction
sites,
site. I
like the
think that's
burning
more
of the
like
bricks?
sand.
Like, those particles that be in the air.
Yeah, that's also a very big area of research at the moment to see how that affects your heart. So we know it affects your lungs. So you can get something called miner's lungs, like that kind of stuff. But the effect on the heart is still being. There's some soft evidence say that there is actually a big effect on the heart for people who are miners, coal miners, who are in factory workers, people who are exposed to coal smoke, fire smoke, all of those things. The smoke itself, that the particles that are made from the smoke, when they enter your body and affect your blood vessels, they have a very similar effect to cigarette smoking. And someone asked the question, weed smoking as well, yes. Vape smoking as well, yes.
Yeah.
They're all bad. They're all
Shisha.
equally. Shisha,
Shisha.
yes.
No, you know how society like vilifies cigarettes more. Like
than all the others.
yes, like cigarettes are so disgusting. And then like in some societies they look at like weed as like I'm just chilling.
Yeah.
I'm just chilling. And then as for vaping, I've never gotten vaping. I think maybe vaping is too young for me. I don't know. I don't know anyone personally who vapes. I don't know anybody personally who vapes. I can't believe for vape. I find it so childish. I'm like,
You
you're in
actually has
public.
10 friends.
Childish. But so vapes are the point of vapes. The original point of vapes was to get people off smoking,
Yeah.
Off cigarettes,
right?
Cigarettes.
Yeah.
So you're supposed to go off cigarette smoke and go on to vapes. So as a relative risk of heart disease with cigarettes versus vapes, higher risk of heart disease with cigarettes versus vapes.
Okay.
But there's still a
There's still a risk.
with vapes,
Yeah.
right? It's just lower with vapes. So people who have never smoked and then start vaping, they're still increasing their risk of heart
Yeah.
disease and lung disease and everything else.
And
So
to be fair, the
I
way
think it's
guys
what
be
people
smoking vapes.
yeah.
It's like they be smoking them way more than guys be smoking
Yeah,
cigarettes.
yes.
That makes sense.
Yes.
I
Like,
saw it
he's
somewhere that
smoking
that's
at
what's
all
making
times.
it bad is that because of how like cigarettes are just like culturally also like in a societal POV, cigarettes are just not accepted. Like, you can't just sit here and smoke a cigarette. Guys will
Yeah.
look at you weird. But because the vape like smells sweeter, tastes sweeter, like guys are in their bed vaping the whole
Yeah,
night.
in
Imagine.
the car.
And they
That
wouldn't do
smells
that with
sweet.
cigarettes.
They can't do that with
So
cigarettes.
you're actually exposing yourself a lot more, and it's a lot more addictive. So in a vape, the nicotine concentration of a vape is much higher than a cigarette. You have to smoke multiple
Is
cigarettes,
it?
and people can get through a vape in like a week.
That's
So you're actually getting a lot more
crazy. Nicotine.
addicted. You're getting a physiological addiction to the nicotine, which
Let
will
me-
make you vape more.
How about because you're speaking about like smoking and lifestyle,
Yeah.
and I know air is a part of that. How about like car AC? Does that have a problem? Because that air is generated. Does that make sense? Like it
Yeah,
goes
but it's
through
not
things.
Burning, I hope. Yeah.
Okay, ideally new
It's
cars.
more- New cars.
Because the old ones, I don't know, man. It
The
might be
old ones are
burning
much
something.
You
Yeah.
know how when we're doing COVID, okay, in most offices, especially offices that had people of a certain age demographic, I don't even think it's just a COVID thing. There's a certain age demographic that finds AC extremely unhealthy. I don't know if there's something that they know that we don't know, but like people that are like 45 plus, anytime they're like, why is the AC on? You guys, you know it's so unhealthy. And then they switch off the AC. First of all, it is 39 degrees Celsius. That's why the AC is on.
But you're not 45.
As a
You'll find out then.
yeah, I'll find that.
Thank you.
And like, the AC is so unhealthy, guys. As in, they're always switching off the AC. I don't know if there's any truth to that affecting, like, let's say, our quality of like breathing and like.
And you see, with
lung
office AC, I think like
performance.
it's a big area, so it might be car, but like a car, which like the windows are up,
Yeah.
is limited, and because also car AC has like when it has just started, there's like a car smell. So I wonder what that is.
Like what that smell is.
Yeah.
I mean, in general, I think ACs are okay. There is, there's a type of lung disease you can get from ACs, but typically from like ACs that haven't been cleaned. So dirty ACs from like dodgy hotels, that kind of thing. So I think it's not the AC itself. It's just
It's like the
quality and
maintenance of the
maintenance
AC.
and cleaning, and how many
Okay,
people are
fair
cleaning
enough.
their cleaning the vents
HVAC and
of
all
the-
that.
of
Yeah.
the
makes
ACs. I
more
think that's where it becomes unhealthy. So if it's not cleaned, if it's not maintained properly, but I think just AC in itself is okay.
Now that you've talked about the different types of smoke, because I think let's just talk about it now, because somebody had asked in the questions.
Yeah,
They were like, as a cardiologist, what would you rank as from
as the worst.
worst? Yeah, from worst to least
Guy
worst.
he wants to smoke. but I
He
want
wants
to
to
like, what's the thing that I can
What
That
is
I
the one
can
I should
do.
release?
He was like, for my heart.
Yeah.
What is the
That
worst?
person does
to the
all
least
of them.
And then
They're
he
just
was like,
like-
he was like alcohol, cigarettes, weed, vapes. What's the worst? Like I think in his mind, he's like, I must
He's
release
like, I need
everything.
one.
But this one, there's one that has to
Give me
stay.
one thing.
Yeah.
Yeah.
No, I know you want some vindication, validation. Unfortunately,
Everything's bad.
they're all bad. But okay, they're bad in different ways.
Okay.
If that's helpful, I don't want to say anything is better than the other, but they all have their thing. So in terms of smoking, weed, cigarettes, vapes, I would put them all on the same level. And that's just because, as I've explained, inhaling smoke is inhaling smoke. So that's that. Alcohol is bad for you in a different way. So chronic alcohol use can affect your heart and your heart muscle. It also affects you in different ways. So indirectly can affect your metabolism, because it affects your sleep. All right, very actually significantly affects your sleep, and people don't really appreciate. And the less you sleep, or the less quality sleep you get, the worse it is on your metabolism. So you're at higher risk of having things like high cholesterol, diabetes, high blood pressure, and that's been studied and proven. If you don't get enough sleep, so like your 7 to 9 hours of sleep, you're at higher risk of all of those.
79.
7 to 9.
Yeah.
This would be
You haven't
Melvin.
counted.
Yeah, this would be Melvin's time to jump in. You know how Melvin was
Yeah.
asleep.
Now
Yes,
there's a guy.
yes, sleep
That is
expert.
the guy.
Good,
Yeah.
yeah.
Tell us what you know.
Big. Yeah, I agree with you.
Like,
What she
everything
said
you
is
said,
true, bro.
Everything
What
I
she
said is,
said,
yeah,
very
I'm
true.
good.
Yeah.
Okay,
Yeah.
thank
like
you.
he has become this person now of like, Guys, I'm not going to lie. It's 8:30. I have to be in bed by 9.
Have you ever read Why We Sleep?
Yes,
That's
He
that's
read
why.
it last
Literally
year.
what
That's
he-
when he
Literally,
became this.
It's the
Every pod,
best
I was coming out
book
a new
with
Why
a
We
new
Sleep
fun
fact.
fact.
guy would
No,
come with
because I was like
constant.
that with all of my friends. Like,
Yeah.
guys, did you know
I love
alcohol
that.
does da, 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 da.
Listen,
Yeah.
in everything he says, he's not like, I'm not going to lie to you, yeah. If we're going to go out, we'd rather go out during the day because I need to get those 9 hours. Like, I really
Yeah,
feel
no,
like
but you know what? He's not lying.
Yeah.
You're not. He's not lying.
Yeah.
Because
It's
let me tell
very,
you,
and I'm very much I'm a very sleepy person, so I enjoy sleep, and when I don't get my sleep, I can feel it. And also, so I do night shifts. I've been doing night shifts for the last 10 years, and I struggle
I had a lot to say about
right?
you guys.
Thank
That
you.
night
So
shift
that
guys too.
that also validated my feelings. The way
yeah.
I felt during night shifts, it validated that
Yeah.
a lot. So
What
night
did they
shift, like
say?
shift workers, also at the highest risk of metabolic disease. So metabolic diseases are things like high blood pressure, diabetes, cholesterol, etc. Highest risk because of that lack, like you're not getting that. Your sleep pattern is completely off, right? So your circadian rhythm
Yeah.
is
That
off,
part.
and that affects all of you. That one. It affects your
I feel
hormones.
like I'm a night
it
shift
a-
worker, man.
Yeah,
You-
these guys, so these
Yeah,
both
night
of them
shifts.
work through the night.
Yeah.
And I just be like, bruh, your brains, bro. I'm so worried
Do you do
for your
that
brains,
by
bro.
choice or because of work?
No, but guys,
him
I
by
told
choice,
you
for
that
him
I
by
saw it from
obligation.
an anthropological POV.
Mm.
What they say that there's some people like because of the
Yeah.
different societal roles everybody played. There were some people that were like watching over the
Yes.
the community
Yeah.
throughout the night. There were those that were supposed to wake people up to go hunt throughout the night. That's why they were like they said like you know how there are those people that say, "Oh, I'm a night owl," or "I'm what are the people that wake up in the morning?" Ali Wam or
risers?
something.
Ali Bad.
Yeah,
Ali Bad.
Yeah.
Go Ali
It's
Wam.
Ali Wam. That's crazy.
Those are the ones that get eaten.
Yeah, Ali Wam. The Ali Bad, yeah.
Uh-huh.
So they were saying that sometimes like you've evolved, like you come from a long line of like night watchers because the basically what they're trying to say is, but this was coming from anthropological
Yeah.
POV, right? And they're saying it's unfair to say, oh, you know, if you want to be productive in life, you get up at 6 in the morning.
Yes.
Not everybody has that type of history.
Yeah.
Or you get like me personally, I prefer to wake up in the morning. By like 2 p.m., my mind is mush. Yeah. But then they were saying there are very many different factors like societal and historical, and like maybe as you guys evolved as a lineage, this is something that has become predominant. I don't know.
So yes, that's all true. And I think also what they talked about that in the book, and they also said how that it's unfair on some children, right?
Yeah.
Because they haven't evolved to be early
Yeah.
risers, and most of the time people have to wake up at like 6 a.m. to go to school, etc. But it doesn't take away from the fact that you still need that number of hours. So regardless of whether you're an early riser or a late owl, whatever, you still need to have a certain amount of hours of sleep.
So the hours do not matter.
So what the actual hours are don't really matter that much,
Yeah.
apart from night shifts, because that's different. Because that's like, you flipped your whole, it's like you flipped your whole rhythm.
Yeah.
And then like your hormone balances are off. That's an issue. But if you're someone who sleeps at midnight and wakes up at 8, you have slept for 8 hours. That's fine. But if you're someone who wants to sleep at 8 and wake up and we can't do math, 6, you have slept for 10 hours. That's maybe a bit
A lot
too
of sleep
much.
is bad.
Yeah, apparently. I don't know if I agree with that one because I like
On
sleeping.
the weekend,
but-
man. On the weekend, I'll be sleeping
Too
like
much
12
sleep is
hours.
also bad. So apparently, optimal sleep 7 hours to 9 hours, ideally 8.
Yeah.
Fair enough.
Yeah.
Because
How
I always
about
thought
if-
the hours were a problem because of like the distractions. Does that make sense? Like on average, I sleep at like 4 a.m. or 3
Until
a.m.
what time?
Like 10, 11.
AM.
Yeah. The only issue is like at 7 when now everyone is waking up to get up. You also hear and wake up and go back to sleep.
Yeah. So
In a
you
way.
haven't slept for that
Exactly.
full- yeah.
So I wonder.
Yeah,
That's
but
all
for
I
me,
wonder.
My favorite thing about that book was the circadian rhythm thing and how like at certain hours of the night you get particular types of sleep.
Yeah.
So if you're not asleep by
and
a
non-REM.
certain time, you won't get that sleep.
But is it about the hour of the night, or it's about like let's say your 4th hour of sleep? It's not about
Nah,
like
he said
2
that.
a.m.
He
I
said
thought
that,
it was a cycle
he
of
said
90
that
minutes.
the
Is it
time
not?
of the night, like at a particular time of the night, you're getting a particular kind of sleep. So if you sleep past a particular time, you're not going to get some sleep.
No, but like imagine someone like look at this, like let's like imagine the nature of somebody's work or the nature of somebody's day, right? It's like let's say for instance they sleep at midnight. They sleep at midnight to 8. Those are 8 hours. They get up at 8, like work out, live a pretty healthy lifestyle.
Yeah.
Like maybe even, and they sleep at midnight because of like whatever they do for work,
Yeah.
right? So maybe they work 8 hours and their 8 hours end at like 9 p.m. 9 p.m. they get home, eat, shower, whatever. They're in bed by 11:30, sleep at midnight. Don't you think that would then equate into, it wouldn't be by 2 a.m. you should be having this type of sleep, but it would be 90 minutes into sleep, you should be having this type of sleep.
I'll let the doctor answer.
Man, because I was going to say,
So
I'll let the
one thing
doctor
that they've also found is that your circadian, if you have a regular schedule, your
Yeah.
circadian rhythm can also move.
shifts.
You can
Okay.
shift.
Yeah.
Nice.
So what you're saying is still true, but
Yeah.
it's just the hours have shifted to accommodate this schedule, this routine that you've now developed.
Okay.
But it only helps if you're in that routine for a while,
What's a while?
like a few weeks.
It is.
Then that's it can start to.
So I can change my thing in like 2 weeks.
You can
Let
change
me
it, but
tell
then you have
you.
to stay consistent. It's the consistency. So people
You
who
might
flip
change it
between
and return
day
it.
shifts, night shifts,
There
mid
you
evening,
can.
then you like you're not getting like a regular schedule, and so your
it's all over the
sleep and
place.
everything is all over the place.
Okay.
Is that why people feel sleepy at certain hours? Like if you're used to sleeping at midnight
Yeah,
and now it's 1, and it's a random night and you're out,
yeah,
is that why that happens? Because
you
your
start to
body
feel
is
sleepy?
used to a certain cycle.
yes. So in that cycle, you can also explain. I feel like I'm taking away all of your.
It's your time to shine.
It's your time to shine.
No.
But it's
Yes.
You agree?
So when you're sleeping, so you have a hormone called cortisol. It's like a
Mm.
stress hormone,
Yeah.
which is high during the day. So your cortisol levels during the day, they're high, they're up. Then when you're going to sleep, I'm sure you've heard of melatonin. So your melatonin levels go up, your cortisol levels go down. So with the cortisol levels goes down, your energy, your heart rate, everything is just on like slow mode. So your heart rate goes down, your blood pressure goes down, everything goes down. So you're tired. And that happens because your melatonin has gone up. It's saying, okay, it's time for sleep. Your brain has registered. Your cortisol levels go down. So even if you're out, your body is telling you it's time to sleep.
And we be
so
forcing
everything
it.
just slows down.
Yeah.
Yeah. And at some point, you just fall asleep because,
Okay, I'll
Unless
just
you
get
take Red
into
Bull.
listener questions. But
yeah.
lastly, low blood pressure.
Yeah.
Tell me about that one. Because I know one person that has that.
Okay.
Is it the same person I know?
Very backbiting patients.
I don't know if
Waiting our friend.
no, she might be mad at me for saying this, but my mom has low blood pressure.
Oh,
Yeah.
your mom.
Yeah,
No, it's
she-
not someone I know.
Oh, she has had low blood pressure before.
Yeah,
I don't know if she has it all the
The
time,
person
but I
I
think
know
she's
as
had it
well, it's never like something permanent.
It just
Yeah.
happens once in a while.
Yeah, because she's our age. And then there are times when,
Like it just drops.
yeah, she's at work and it's the time when she almost collapsed,
Oh, I know
like
that
at
is.
work.
Yeah.
And then they were really dramatic. They brought an ambulance
I
to
know
take her to the hospital.
Yeah.
She almost collapsed.
As in, because she was texting us. She texted us like, guys,
I'm in an ambulance.
please, where am I in an ambulance?
Yeah. She's texting,
She's
man.
texting.
and snapping the
Like,
ambulance.
go guys, have you
Yeah.
been inside an ambulance?
This
Yeah.
generation is not serious at all, bro.
Then she reaches the hospital and
Yeah.
they're like, oh, your blood pressure got really low and that's why this happened.
Yeah.
Like after like a week or so,
She was caught.
hey, okay.
fine.
Yeah.
So blood pressure, low blood pressure, it's a difficult one. So there could be a lot of factors. It could be some people just naturally have lower blood pressure, and sometimes if you're a smaller person, your blood pressure might just be slightly lower than average. Other things, water and salt intake. So water and salt directly affect how much volume of blood you have in your body. So if you have low water, low salt, you're likely to have a lower blood pressure. Sometimes happens when you're sick. That's for a different reason. But if you're very unwell, your blood pressure can also go very low. So people who get pneumonia, infections, sepsis, that just means a very bad infection. Your blood pressure can also go low. So it's different. There are different reasons. So there's some people who are naturally, so we just say like physiologically, they have slightly lower blood pressure because they're smaller people. It could be related to how much water they're taking in, how much salt they're taking in, if they're eating and drinking normally. If it was a particularly hot day, So you can have something called vasovagal. So it just means that it's like a neurological response to different stimuli. So some people get very stressed and faint, or they get very scared and faint. I don't know if you've seen that before.
Yeah.
So
What's that called?
vasovagal.
Vasovagal.
Yeah, so it's like an emotional.
such a
So
fine
your
name.
emotions can actually do a lot to your body. So it's an emotional response that causes a neurological response that drops your blood pressure. That's called a vasovagal. So it can be like a stressful stimuli. It can be if you're particularly hot. Sometimes that can also cause it. So there are very many different reasons. So it can either be a natural thing or something that's more related to you actually being sick. So actually, when someone faints, they should go to the hospital. It's not being dramatic. Even if they feel fine afterwards, and commonly with vagovasals, they faint once and then they're unwell for like 2 seconds or 2 minutes, and then they're absolutely fine. And that usually tells you that it's not something very sinister.
Okay, sorry to take you back to the sleeping, Jazz. I watched a video and some guy was saying, I don't know whether he was just cooking, but he was saying that drinking energy drinks and coffee, what they do is like they prevent the secretion of that melatonin. Is it? Melatonin. But you still get tired, but you won't sleep. Is that, how true is that? Like,
You
was it
still
just
get
cooking?
tired,
Interesting.
but you won't sleep. Yeah, so different energy. So like, so do you mean things like Red Bull, caffeine? Yes. So they reduce your melatonin production, but not necessarily. So your cortisol levels might still be low, and that might still make you tired. But then you're getting this artificial, like external
Boost.
stimulation or boost, which means that your body will keep going, but you're tired. So actually, that's exactly how I feel when I drink caffeine. I'm still tired, but I'm awake, which
Then
is
you
I
can
feel like
sleep.
the worst kind of state to be in. And similarly with alcohol, sometimes that can do that. Like you can be tired but awake.
That's interesting.
We've recently come to the realization that a huge part of the hangover is the sleep deprivation. Like when we go out and have a good time and we're in bed by our usual bedtime, we wake up feeling pretty okay in the morning. Like it might be some like a little bit of a headache, but then when you go out and then you're in bed at 5 a.m., first of all, you always wake up at 8 a.m., yet you slept at 5.
Yeah.
And then you're just like, I am dying. I am on the brink of death. And then you start saying, guys, 27 is giving me.
Yeah. Meanwhile, you've been up for 24
You've been
hours.
up for 24 hours.
And you slept for 3.
It's not being 27 years old, I
Yeah.
promise.
Yeah.
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 And please note, this is like 3 nights in a row. We're not talking about this.
Oh, wow.
Then have you tried that thing of I'm beating the bender? You've never. Not for me. It's just like we're
Just
talking
some
about
people.
our demographic.
I'm going to be honest. I had over bender for the first time, like 2 years ago. And I struggled to believe. I was like, wait, you guys are partying for 3 days in a row. Why?
3 days is rookie numbers.
Why? 3
Why is
days.
a good question.
You guys don't like to
For
sleep.
me now, I can't do it because I read that book. It just made me like, now like I'm very, very conscious of my sleep. But before that, like uni, I
Okay.
was super careless.
I
Monday
needed
to
know,
Monday.
In uni, I used to go out on Friday night, right? Go out Friday night, come back like 3 a.m., and then sleep until like lunch on Saturday. Saturday was for recovery.
Yeah.
Saturday I would stay in, would sleep, go to church Sunday morning.
But
go
you've
back out
recovered
Sunday
by
night.
6 p.m. Saturday. That's the thing.
If we had money in uni, we could very easily do it the whole weekend. Like
No.
Friday, Saturday, Sunday. We had no
You're very
regard.
disciplined in university. That's nice.
Yeah.
Guys, why? 3 days. You guys don't like sleeping.
In
Guys
uni?
You guys don't like sleeping.
Nah.
Not
Like-
right now, yes.
Till today, I need 1 day a week that's a nothing day. I call it a nothing day.
I was literally just saying this because I
need
had
m-
my nothing day yesterday.
I need my nothing day.
And my
My
parents thought I
nothing
was
day, I
sick.
exhaust the sleep in my
Yeah.
body.
Yeah.
You guys are sleepers though.
Yeah. I won't lie. I
Yeah.
can't have that. I'll be so restless.
Yeah.
You can't have a nothing day?
I can, but
Like I'll have to find
bro.
something.
I have to do something on my nothing day, bro.
I can't not. So yeah, I literally did this yesterday, right?
Yeah.
So I've started working. I started working, so in hospitals here, as well as doing things with Revive, as well as I'm just doing many things. So I've ended up unintentionally having a 7-day week. So yesterday, I was like, I can't. So I stayed in bed, had a nothing day. My parents said I was sick, so I didn't leave. I slept for a good, I think, 7 hours during the day after my 8 hours of sleep.
And that's you sleeping.
Not constantly 7 hours. So maybe I woke up, watched some
in and
Netflix,
out,
went back
yeah.
to sleep. But a nothing I would recommend.
I tell you, her nothing day is probably like 18 hours, man. I won't lie to you.
A what?
Of sleep.
What?
Your nothing day.
My nothing day.
It's
First of all, in a good nothing day, like if I can enter my bed on Saturday at 9 p.m. and wake up at 9 a.m., those are 12 hours of sleep. Uninterrupted.
How?
You're literally in hibernation.
Chicks melatonin.
It's strong.
It's different from ours.
There's sometimes when I wake up and I have not moved, like I have
Yeah.
not changed direction. So I wake up and
Yeah.
like my neck is
Your bed
sore.
is still laid.
Yeah.
Yeah, I wake up on the bed, same everything. My neck is sore because I've been in the same position for almost 12 hours. And the fact that, and I think it's probably unhealthy, but the fact that I've been asleep for so long, I wake up like feeling sleepy. Like
Yeah.
I can't wake up and be awake if I've been asleep for 12
So
hours.
that's part of the sleeping too much.
Yeah.
Also being a problem.
I wake up
But
feeling
sometimes
sleepy.
Your
and I'm
Sometimes
rhythm.
you need a reset.
You've started the next
Yeah.
circuit.
Yeah.
I'm like, I need an hour of
Yeah.
napping to recover.
Sometimes you want to wake up and be like, yo, where am I? bro?
Yeah.
Yeah. Okay, let's do some mobster subs, man.
Oh, something that I really loved with these questions. We got a bunch of questions from med school girlies.
I noticed.
Yeah.
Yeah.
Got a bunch of like career oriented questions. I like that.
Yeah.
Nice.
Okay.
Shout out to our med school. I think we have a lot of like guys
Our
in
doctors.
Hungary. You know, guys who are studying in Hungary.
Loads
Hungary
of
med school guys.
Yeah.
Those are our guys.
I need to know. Does
They
Hungary
be
have really
complaining.
good med schools?
It does.
It does.
It does. It does.
Is
Yeah.
it because a bunch of people, like I'm going to
A lot of people are going to Hungary.
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 Yeah.
Shout out Hungary, bro.
Okay.
Angry, man.
Hi, Dr. Amanda. On your return to Uganda as an internationally trained specialist doctor, did the system here require you to do supplementary training?
So, hi. No, they didn't, but it's because I got my medical degree from the UK. So Uganda recognizes UK training and UK qualifications. So all I had to do was register with UMDPC, which is the Uganda Medical and Dental Practitioners Council, and just show my qualifications from the UK and get them certified here, and they were directly recognized. So I'm not sure if that's the case with if you're qualified from other places. I think the US, there may be some other countries where they have the same arrangement. So I'll just check with UMDPC and they'll be able to let you know.
Yeah.
Okay. Shout out colonialism.
Yeah, man.
Like,
Shout out.
Hated but love
You're
it.
still winning, man. You're still
John
winning.
Speak and them, man. You
Yeah.
didn't-
Okay.
okay. Hi, this is coming from a guy. Am I crazy for opting for training and working out as opposed to telling a stranger my problems? I don't believe in therapy.
Okay.
I saw that question.
That's a good question. That's interesting that it's coming from a guy. Or maybe not. But a lot of guys will go to the gym to solve their problems. And to be fair, it helps. Right? So going to the gym, you release there's certain, good chemicals you release in your body. It will make you feel temporarily good, relieve your stress, open up your mind, etc. So exercising actually is a form of therapy, but is not in isolation. So exercise in isolation won't solve all of your problems. It will make you feel better. It can help clear your head, as I mentioned. But if there's certain problems that you have that need just someone to talk to, it doesn't have to be a stranger. It can be a friend. It can be a relative. It can be your parents. Sometimes actually talking through your problems and saying them out loud and getting someone to resolve them with you can be helpful. And there's some things that you may not be able to see yourself that someone else can see. So as much as going to the gym is great and they should continue doing that, if there are things that are not, the underlying things that are not being resolved, therapy is a way, but so is talking to friends. If you feel very opposed to therapy, and I know some people feel uncomfortable saying things to people they don't know if they can trust them, and that's fair. So yeah, I'd say talk,
Yeah.
and go to the gym,
Yeah.
or talk to your friends in the gym.
Yeah.
True.
Yeah.
I like that.
And
I like that.
I think it's interesting that he asked, like, am I crazy? Because if you're crazy and you go to the gym, you're going to still be crazy after.
You
that.
might throw a
Yeah,
dumbbell
yeah,
at
yeah.
someone, man.
Yeah.
Yeah.
Like
I hear it.
lifting a dumbbell won't take away
Won't
the
make you not
yeah.
crazy.
Take away the
Yeah.
crazy. Yeah.
Yeah.
Okay.
Yeah.
Are
You can
going
have
to
muscles and
live
be
in the
crazy.
gym?
Did you guys watch?
If you lift like a very heavy dumbbell.
Did you watch Split?
Really?
Remember Split, the one character that was like super
Yes.
buff.
Yes.
No.
Have you watched
I never
Split?
split.
It's the guy who did what's that Idi Amin movie?
The what?
The guy
The
with
Last King of
Last
Scotland.
King,
Uh-huh.
the white dude from Last King of Scotland.
Uh-huh.
He did this movie where he had like multiple personality disorder. That what it's called?
Mm-hmm.
And one of his personalities was
like a buff
super
guy.
jacked.
So how
It was the same guy.
Oh, obviously. So I was going to
Guys,
say,
So was he
how-
actually jacked in
He
real
would
life?
get more jacked.
when
No.
when
It
it's
was
that
It was
personality?
insane.
It's Hollywood.
You need to
That's
watch that.
it. I'm like, really?
That movie is too good. You guys need to watch
Like
that movie.
his maybe
That's so
his
interesting.
stance would change and like his
As in his muscles would bulge and he would. It was insane
Sounds
to
like
watch.
anime. I won't
I
lie.
wanna
You
watch
need to
that.
watch
That
it. It's
sounds-
too
that
good. It's
sounds
too
good.
good.
Okay.
Yeah.
how was your journey to become into becoming a cardiologist, and what advice would you give to the girls in their early 20s?
So,
I want to become cardiologist.
who want to become cardiologists?
Probably, yeah.
Okay. I'm assuming they're already doctors if they're in their early 20s. Okay, let's assume they're already doctors.
Or like in med school.
Or in medical school, yeah. So my journey to become a cardiologist wasn't very straightforward. It was a bit convoluted. I didn't always want to become a cardiologist. I actually wanted to be a pediatrician at some point. Actually, for a long time, I wanted to be a pediatrician. Things changed. What influenced me the most was actually the people who I worked with. And also my interest, weirdly enough, my interest in public health and prevention. And realizing actually cardiovascular disease is a huge part of, prevention, and understanding that as a cardiologist to me felt really important. So throughout my journey through medical school, I kept a very open mind, did what I needed to do, didn't really put so much stress on myself in terms of, trying to publish papers, etc. Although my colleagues did, so maybe don't listen to me that much. I would say if you have a passion for cardiology, it can be anything you want it to be. There are a lot of different ways of being a cardiologist. You can be into research, you can be into prevention, you can be into intervention, where you have to be a bit more skills-based. You can be someone who's more academic. So it really depends what your interests are and why you want to go into cardiology. Based on that, speak to people, which is what I did. I spoke to a lot of my consultants, my professors, people who I looked up to, and I thought, okay, I like what you're doing, and I like what, the impact you're making. I like the kind of work, the kind of patients that you work with. How did you get to where you're going? And that's kind of how I paved my path. And yeah, so at certain points, I almost decided not to do medicine, and then I met some people who convinced me that actually not to do clinical medicine, but to go into public health. But I've met people who've shown me that actually you can do both, which is really helpful. And also realize that there's not just, as I was saying, there's not just one type of cardiologist. And I always assumed cardiologists were old, arrogant white men, which is
Fair
kind of
enough.
the stereotype that most people have in their head. So when I said I wanted to become a cardiologist, they'll be like, "Oh, you don't look like a cardiologist." And I'm
But
like,
actually, like,
I don't know what that
2 or 3 people
means.
sent that in. They were
That I don't look like a
"Did you say
cardiologist?"
cardiologist? Like, there's this one girl who said, I'm in like second year of med school, and I've like sometimes worry that I'm going to look like the stereotypical doctor.
yeah.
But then, like, looking at you, I can't believe, like, oh my God, I'm so inspired. Like, that was just her submission.
That's nice.
Oh, that's nice. Yeah, because there are not many. And actually, I was inspired by another young black female cardiologist who I'd seen
They call that
when I was still
representation.
early in my training. So when I was doing internal medicine, I was doing my exams, and she was teaching on one of the exam courses. And I saw her, and she said she was a cardiologist, and she's Sudanese, British, and black, and young, and we kind of looked alike. And I was like, oh my gosh, this is amazing. I can't believe she's actually doing this. And I got her number, and we talked, and that really, really inspired me, because everyone else I'd seen was male, and she was also a nice person. Not to say that cardiologists are not nice, but there's a certain stereotype of old school professions that are just not you wouldn't assume that a nice young black woman would be in that position.
Yeah.
So just speak to people who you, who you like, whose personality you resonate with, whose way of work you resonate with, and see what they've done and try and do the same. And you can speak to me if you want.
Ooh, we love that.
Yeah.
Okay.
I wonder if you were not a cardiologist.
Yeah.
Okay, when you specialize, can you still practice
Other things.
other fields? Like if, say, you wanted to do occupational therapy.
I would have to stop doing cardiology and go and do occupational therapy. So you can't really do. So once you become so the actual process is you do 5 years of medical school. This is in the UK. 5 years of medical school, 2 years of a foundation program, which is the equivalent of internship here, and then you do internal medicine. It used to be 2 years, now it's 3 years, and that's where you do all the different types of internal medicine. So like gastroenterology, cardiology, respiratory, so different organs of the body as a physician. And then you choose one of them to do for 5 years. Again. But you're working for those 5 years. You work in that specialty for 5 years and you gain different skills, different competencies. And at the end of those 5 years, you become a consultant in cardiology.
Wow.
Yeah. So it's a long...
You've just
long.
mentioned 12
I'm not gonna
years.
lie, I think lawyers
Yeah.
need to train more, bro. Like, honestly,
No.
every other
100%.
profession
Yeah.
that like people mention in the same breath as lawyers,
Yeah.
they train
A lot
at least
more.
5 years more than lawyers train.
Oh no, the
Which
one
is-
thing, the one
engineers?
thing I feel.
Engineers, I feel like,
They do 4 years.
Engineers do train, but
but then after that, don't they have to like do another pre-qualification of like 3 years before they can be
Who
called?
engineers?
Yeah.
Not
Actually.
Engineers.
No.
No.
not really.
Is it?
Maybe architects. Architects do.
Oh, okay,
a
maybe I
lot.
was thinking about
But I feel like
Yeah.
doctors,
Architects
because
do
you're
a
dealing
lot.
directly with someone's life. Like,
Yeah.
Even
Direct.
lawyers.
But
Lawyers,
lawyers
bro.
technically.
Lawyers
That's
also
direct.
deal with
Lawyers, you don't have
Like,
that heartbeat
something
that
I
beats on
think
the
so
screen.
though, about like LDC, because I feel like LDC would be, it's technically like law school. Like fine, uni is law school, but I feel like LDC, you're doing the practical bit of it. I don't think LDC should be a year.
Should
I
be
think
like
what
2
makes
years.
LDC is that they pump in the practical side of 4 years into 9 months. That's what makes it crazy. I think LDC should be like 2.5 years, if I'm being honest. Because I found that the system of education in LDC was a lot more beneficial than what we did in uni. Like this system of you come and you do things practically, like you have moot courts, you argue things out, you prepare for cases. I found it a lot more practical. But what made it difficult was I'm studying something I did for the whole of first year uni. I'm doing it in a week.
Yeah.
5 days. That's what made it
Yeah.
intense.
Yeah.
You know,
I think it should be like 2.5 years. or maybe 3.
ideally, I think, and this is going to be me being like a dark horse, I definitely agree with everything you've said. I think the issue is most of these other professions get experience on job. Does that make sense?
Yeah.
Mm-hmm.
Yeah. With doctors, your job now, the person is already dependent on you on day one. Does that make sense?
I'm not gonna lie,
Like they kind
lawyers
of
be-
ease
Lawyers
you
be
into
destroying
it.
people's lives, bro.
I
True.
need you to know
Like
that.
I don't know, dude, like you'll make a mistake and legitimately you might have ruined someone's life.
That is true. So for me, what you're saying is lawyers, they ease you into it. Does that make sense? Like
Okay.
on your day one as a legal assistant, they're not going to put you in a court case there.
No, let me tell you why though.
They ease doctors in as well. Like they're not gonna say go do that surgery by yourself on day one.
Yeah.
Like
Okay,
they'll-
that's great.
they say yeah.
Then you go and find the iota.
Yeah.
But I also don't think there's something you need to know though. When you're like, let's say day one as as a legal assistant, how are you not going to court, right? But that heavy lifting you're doing,
Bruh, they can give you
Fair
work.
enough.
Okay?
I don't know. I'm even arguing.
you can.
Yeah.
You can.
I worked
push
as an
yourself going to
accountant and I
court.
found out on day one. So fair.
You do so much heavy lifting, and when things don't go like their way, like whoever goes to court, what you'll
You're
go
the
through.
one who is going to fight.
Let me just say, lawyers are not known for being
My
nice.
dark horse has gone.
Yeah.
Yeah.
I don't know. Anyways.
Yeah.
Yeah.
12 years of school is mad though.
Okay, I don't know whether this also applies to doctors. Okay, let's say the surgeons, yeah? You know, like in the airline pilots and all that, in case
Yeah.
a new aircraft is like released, pilots are taken and then they are taught how to fly it.
Yeah.
So I'm also asking, like, in case there is like a new procedure of how you can go about a certain surgery,
Yeah.
as surgeons, taken back to a school and they're taught how to do
Like, do they need to renew licenses and
exactly,
stuff?
yeah.
So not renew licenses, but you'll go on courses. So we regularly go on courses actually for different things. So if you want to skill yourself in something, you'll go on like a week-long course, depending on what the skill is. Could be a week-long course, could be a month-long course, whatever it is. And you train in that thing for a certain period of time. You have someone who's supervising you, and you watch someone do it, or you learn the theory, watch someone do it under supervision, and then after some time, someone signs you off to say that you can do it yourself. And that's typically the process for pretty much everything that we do in medicine. So initially, learn the theory in medical school, observe someone doing it, also medical school, do it under supervision, that's when you're a doctor, and then after a certain period of time of supervision, someone will sign you off and say, I've watched this person do this X amount of times, and I'm happy that they can do this particular thing. If they're already qualified, so let's say they're already a consultant surgeon, and this new machine comes out, they have to get training in that new machine, or ideally get training in that new machine for a certain period of thing, and they might do it on a mannequin to begin with, and then progress, do it on a real person with someone who's qualified to do it already with them, and then they do it themselves. So there's a lot of
Grey's
pilots.
Anatomy is
It's very
23 seasons.
it's very
Grey's Anatomy is one career of one person, 23 seasons.
Grey's Anatomy is
Yeah.
I think
Nice line.
that might answer this question somehow, because they say, how do you stay current with the latest developments and advancements in cardiology, and what resources do you recommend for ongoing education and professional development? Yeah.
Okay, so specifically for cardiology, so I'm still in my I'm in my advanced training program. So we have regular sessions where people will come and teach you about different things. So we have online sessions, face-to-face sessions. So professionals and experts in different fields will come and update you on whatever it is that's happening in their field, and that usually happens every month or couple of months. We also have internally, depending on within the department, we'll have weekly sessions where people will come and present cases. So they encourage everyone to be able to present a case and then talk about the the research or anything new around it. So we learn from our peers in that way. We learn ourselves. We'll do readings. There are a few podcasts that I listen to. So there's one called the Heart Podcast, and that's by the BMJ Heart. And then there's also one called, I think it's called Updates, or This Week in Cardiology. So every week they just talk about the new advancements in cardiology for the week. And it's nice and short, because my attention span is very short. So it's 20 minutes, a discussion about what's, new research that's come out, discussions, and then you get a quick summary of what's going on. And then generally the different articles you can read, or different publications. So the BMJ, that's the British Medical Journal, is the one that I'm used to, just because that's where I practice. But there are a lot of other online resources. European Society of Cardiology is a big one for cardiology.
Cool.
Yeah.
Okay.
Nice.
As a 30-year-old with a desk job, what must I incorporate into my weekly routine to maintain a healthy heart?
Good question.
Good question.
Yeah.
Very good question. As a 30-year-olds are still young. Just want to
But with
put that
that
out
desk
They told us to
job.
screen at 22. Man.
Yeah,
but
you're
with a
still
desk,
young.
so
with
a desk job, you're imagining let's say you go to work at 7:30
yeah. Then you sit
and you leave
until
at
6.
5:30.
I wonder, does this password mean lifestyle or ergonomics?
Huh?
I mean lifestyle.
Lifestyle.
If I'm at
okay.
my desk 11 hours. Okay,
Yeah.
10 hours a day.
So
Okay.
yeah.
I'm going to go home and watch TV after.
All right.
Okay.
Yeah.
So some depends on where their office is.
Mm-hmm.
So people who have smartwatches, it will tell you to stand up every hour, right? So if you have a desk job, just make sure you stand up and do some kind of activity every hour. So get up, walk and maybe don't make tea. Just walk and pick water, sit back down. Just make sure you stand up and do something active with your body every hour. There's a podcast I was listening to this morning actually, which was talking about exercise snacks. I think they called it exercise snacks, where they're talking about how if you do a short 1 minute of exercise every hour, can have the same benefits of you doing 1 hour of exercise in the day. And the theory is that you do something really intense for 1 minute, and then you rest, and then you go back every hour, and then you go back to what you were doing. I don't know how practical that is in a work office space.
Imagine you
But-
start doing hits, you just run.
No, so the example they
So
gave is
doing
like just
burpees.
sprint up the stairs for a minute, then go back and sit at
Yeah.
your desk. Or do, not burpees, or do like squats for a minute, or do a plank for a minute and go back to your desk. So again, depending on the work where they work, that could be something practical that they can do. But even something as simple as, just to begin with, get up and walk around, right? Go for a lunch break, leave your desk for lunch. And then when it comes to food, I know a lot of people, okay, I say a lot of people, myself, if I don't meal plan, I'm eating a lot of nonsense the whole day. So try and pack food. So you know you're going to have a healthy meal. Have your breakfast before you get to work, pack some snacks, and pack a healthy lunch. So even though you're sitting down and maybe you're not as active, at least you're not sitting and eating chapati for break,
So
tea,
what do you think
etc.
of like the stereotypical Ugandan like meal? Like, okay, leave chapati. Like if like
Ginos
it's, like,
and rice.
The
Yeah, like-
buffet has
like-
rice.
yeah, like it's matoke,
matoke,
groundnuts,
Irish potatoes.
Potatoes, chapati.
Yeah.
And three
but-
sauces.
not very many workplaces
leave
are going to
chapati.
give you a chapu. Let's
Really?
be very honest.
Okay.
But like, let's say they give you
They give chapos.
Chapos. I was also
I
like,
feel like
I've not been in office for long.
Offices.
since starting work here, the standard thing, because they give us free snacks, which is
Yeah.
really nice. But it's always juice and chapati, juice and samosas.
No, but I mean on
that's
like the lunch
standard.
buffet.
Oh, on the lunch buffet.
It's usually like matoke, rice, like groundnuts, and like beef. There's always two types of sauce.
Mm-hmm.
Then they might throw in a sweet potato or a pumpkin
Oh, yeah, yum.
Okay.
or a yam.
Some gonja
Right, yeah.
or some.
Then some kagonja.
Yeah.
So would you?
And
'cause-
like veggies.
That was green. That's
and then
okay.
there's always dodo or like nakati or something. But now that I think about it, I'm realizing like 5 out of the 6 things are carbohydrates.
Yeah.
Hey, let me tell you, Uganda.
So
So is that a
Because you
good
need-
thing or a bad
is
thing?
that a good thing or a bad thing? Because technically, like I think
So-
in the broader sense of things, this is not unhealthy food.
It's not unhealthy food. But also, no one has said you have to have all 5 carbohydrates,
Carbohydrates,
right?
yeah.
Like they're just there.
I
as an
mean, if
option.
they're in
Like,
the
that's where we
buffet.
go
I don't
wrong.
have at least.
That's where we go wrong. Like you see the buffet and you feel like you have to have every
But
single
let
thing
me
on
tell
the
you,
buffet.
unless I don't want it,
You're
I'm
gonna
not
put it there.
skipping that dish.
I need something to chase the rice down.
But I put the matoke here near the rice. Leave space
Yeah.
for potatoes.
Yeah.
You first look
So-
at the whole buffet, then decide one.
Yeah.
Okay, I mean, you can have. Okay, so what I would say is, actually, doesn't matter if you pick all of them. It's just the portions. So, okay, let me now take it back to you. How do you think your plate should be divided in terms of vegetables, carbohydrates, protein, fat?
I
Percentages.
think something that I've gotten to learn of recent is I remember when we just started, like, oh my god, I should start working out. Everything was protein this, protein that, what. But then a very big thing for me, at least right now, is I'm trying to prioritize fiber. So
Why?
Yeah.
sorry?
Why?
Why? Because I don't know, my gut has not been the best.
So it's
for the
like a
last
metabolism.
1 year.
Yeah.
I don't know what's up. So like I'm trying to like I began like as of like 2 months ago. I started like having lots of chia, lots of water, lots of like I'm just trying to prioritize fiber. I saw somebody say that Ngo guys don't get cancer from lack of protein. Guys are getting cancer from lack of fiber. Like you get like your colon is dying. But anyway, so I would think that maybe loads of like greens.
Percentage. I said percentage.
Percentage wise.
Yeah.
Okay, percentage wise, I would give like greens like 40%.
Is it?
40%.
Okay.
I'd give
Are you shocked because it's high or low?
That's
I
high.
mean, it's like 5% greens, man.
no, I'd give though I really like veggies.
So do I.
So do I.
Ideally, I could live on veggies and meat alone. You get
Not ideally.
meat and veg slaps.
Okay,
I
it
can't
depends
lie.
on the veg.
Yeah.
The problem is
Yeah.
the veg I like also has things in it. Does that
Like-
make sense?
Like what?
Like mayo.
What is
I see your issue.
Yeah.
We'll get to you next.
Ideally, I think 40% veg.
Okay.
40% veg, 30% like beef or chicken or fish or something like that,
30%.
or beans,
okay.
whatever is there. And then I prefer matoke to rice, if I'm being honest.
Okay.
I don't like pumpkin. I don't like cassava.
What is
I don't
matoke?
like,
It's a carb.
Yeah.
matoke is
Yeah,
a carb.
okay.
It's a carb.
So I would get matoke, and then for chapatis, like I said, my gut has not been having a good time lately. If I eat chapati today, I might not be regular tomorrow. I don't know what's going on. So I'd say matoke, greens, beef. That should be like my lunch.
Okay. What's your percentage?
On like a normal
plate.
buffet?
Yeah, on a
Brother,
plate.
rice.
Rice, what
Rice
percentage?
is what? What percentage is rice?
Actually,
First of all, me I
don't
be
say you're
getting both.
the
Yeah.
Me too.
There's pilau and there's
If
veg
there's
rice.
pilau and
So
white,
you're getting
I'm
the
getting
white rice
both.
and the brown rice.
Yeah.
Love it.
You
Yeah.
guys are barbarians.
That's
I
so
know
good.
that guy. Whenever I'm behind a guy like this in a line, I'm like, yo, what's wrong
Why
with you?
would you get both?
Yeah, okay.
Get both and mix them in that like now it looks like one rice.
Mad. Okay.
You, with the science.
But rice is like 30%.
Okay.
Okay.
Then the other 30% is like meat,
Okay. That's 60.
which is crazy. But I really
No, that's not crazy.
meat. If there's meat, I'm there. Then veggies, but ideally I would go for the things that are more like avocado than like the actual greens.
Oh, okay.
Yeah. So like veggies and fruits will make up most of the rest of it. But like if
Okay.
there are other things like yams, blah blah blah, I'll throw them in like one yam. So maybe that's like 35% rice, but it's mostly rice, meat, and double greens, avocado, blah blah
I
blah
like
blah blah.
mixing sauces.
So
like,
do
I'll
I.
get meat and like groundnuts, or I'll get like meat and peas.
Okay.
I like
Could
mixing sauces.
never be me.
It
I will
tastes nice
mix
to
the
me.
meats.
You'll mix the
Chicken,
meats,
beef.
and then you mix the rice.
Yeah.
And then veggies with mayo.
Yeah.
Cool.
Not with mayo. But okay, but you know those veggies that have like that white thing.
Like coleslaw or something
Coleslaw,
like
yeah,
that. Yeah.
So then
I
what's
said
your
mayo.
percentage of the
Okay.
veggies and the meat? The meat is 30. The rice is, what did you say, 60?
30.
36?
Mm.
Yeah, 30 to 35. Because it's 35, then you add the
Yeah.
yams.
Yeah.
So I feel like
So
that's almost
everything
40.
else
Yeah.
is veggies of some sort or fruit.
So that's like
Or
30.
Normally, I'll also get like a fruit bowl
Oh,
after.
I don't get the fruit ball.
Mm.
I don't. I think also one of the reasons I don't like fruit is most times fruit cuts my tongue. I've always had one of those tongues that's really prone to, like even something like carbonated drinks cut my tongue. Yeah, so I'm not
Fair
a big
enough.
fruit
I
person.
don't drink carbonated drinks anymore.
Interesting.
But yeah, fruit bowl.
Food balls.
Yeah.
Okay.
Essential.
No, mine is, I'll say rice, potatoes, the carbohydrates,
Yeah.
50% of the plate, right? The greens, maybe like 20% of a plate.
Okay.
Then I'll have some peas
Some
or groundnuts.
meat.
Those will be like 10%. And then the meat will be the other, what's left, like 20?
Yeah.
I don't need too much
That's
meat
interesting.
I feel like my
I think
plate
like-
is the worst.
though. Like a piece of chicken
Mm.
will be like 20.
Yeah.
Do you get a fruit ball?
By then I'm too full.
Yeah.
I'm too full by then.
Yo, I can divide your plate like those Bukidis plates with
Exactly. Yeah. So what do you recommend?
So if you look at those kiddies' plates, right? You know, it's always like half.
half. Then
That big half,
yeah,
that's supposed to be vegetables. So 50% of your plate should be vegetables and fruits. Fruit and veg.
Okay.
That's 50% of your plate, but mostly veg. And then protein, I don't say meat, but protein should then take at least 30% of your plate. And protein can be meat, but also so the fat you get from meat is bad fat. The fat you get from plants is good fat. So you want to prioritize plant fat over
Animal fat.
animal fat. So when you're getting, if you want protein, if you want meat, go for things like fish, chicken, if you must. Avoid beef and pork. Have a lovely. I know I said pork. I'm so sorry. I'm sorry.
no,
I'm
both
sorry.
of them. You said avoid beef.
And
And-
pork and goats. Those
And
are
goat.
probably the worst in terms
And
of
goat.
What are the worst?
yeah. In terms of animal fats, those are. I mean, so avoid. I'm not
Those are my favorites. I
ideally
won't lie.
stop, but just reduce. Like don't eat them every day or every week. Maybe like do it as a treat, like once a month. Have some pork.
Once
a month. have
Ugandans
some-
are like,
I know you're gonna look at me like, what are you talking about? But just try and reduce it because the fats that you get, those are the unhealthy fats, and then the rest of it should be carbohydrates. And carbohydrates is such a small amount of what your plate should be. Actually, it's still important. They should still be there, which is why I'm saying like if you're gonna have a buffet every day, just alternate. Say today I'm going to have matoke, tomorrow I'll have rice. Next day I'll have potatoes. Like, you don't have to have all of them on your plate today.
Yeah.
That's
Look at me
interesting.
like,
I
what
have
are you
to
talking
really
about?
reprogram.
You have to
Right.
reprogram your whole.
Actually, not just
place.
you. I know who to blame.
Oh.
The service providers be bringing like one thingy of greens
Yes.
Yes, the greens
Yeah.
are always sold.
and
You
like
have to
3
go
big
really
saucepans
early.
of
yes.
rice.
You have to go
Yeah.
really early to get, if you want to
they'll
maximize
finish.
greens,
Yeah,
you have to be the first on that line.
it's true. So I guess this podcast should be for the
Service
Service
providers.
providers.
Yeah.
this is they're the ones that need the
No, but I
education.
think it's a Ugandan thing. Like, you're like, I always tell my mom that I don't know how I consider it a Ugandan male thing. I'm like, I don't know how I'll be like if I marry like a traditional man, because having grown up with a mom, you could say, mommy, today I'm actually making a salad. I don't feel like cooking yet. But then anytime I'm around like those ultra traditional homes, and they're like, no, yeah, we're going to make dinner. Of course, we have to make matoke, sweet potatoes, pumpkins. I'm like, you guys, relax.
Chill. Yeah.
It's your third meal of the day. Why are you eating 6 things? No way.
I don't know, man. May I eat what's there. I might be the
You do
simplest
the,
guy.
no, but I do the same thing. Weddings are my biggest enemies because it's there. You feel like it should be on your plate.
Thank you.
Oh, you're wasting, like you're insulting the service provider,
No,
right?
you're not.
That's you.
No, but let me tell you the bad thing about this veg and meat thing.
Yeah, out of respect.
If you want to fall sick, be of the veg and meat life.
Well,
The last function I
that
attended.
just sounds like a chicken salad.
no, like
Salads are very
Yeah.
poorly.
no. I go like, let's say, because I'm like, oh my god, it's a wedding. Kawa, I can't
Let me have all the
insult you.
salads.
Yeah.
I'll have all the salads and I'll have all the meats.
I hear you.
The last function, actually, I had 2 functions one weekend. I had this sister's wedding Saturday.
Yeah.
I
The
remember.
next day I had another function.
Yeah.
That second function, we left the function at 7 p.m. By 2 a.m., I was on the brink of death.
Yeah.
The brink of... And I said thinking, of all the 4 types of salads and 4 types of meats,
Which one caused this? Yeah.
which one? Which meat is old meat or like wasn't... Which salad was cut with like dirty hands or...
Yeah, I hear you.
Yeah, and that's like uncooked salads.
You're just eating a leaf from outside.
They're a bit
No, I
tricky.
think that I can't believe, Melvin, you didn't bring up H. pylori.
Yeah, we can talk about it though.
Uncooked salads.
Yeah.
Yeah.
For me, my question in this regard will be, in Uganda, I think on a broader scale, okay, let's start with like ulcers. On a broader scale, I think we've always correlated ulcers with stress. Okay. On a broader scale, not a Ugandan scale. I'm coming to Uganda.
Oh, okay.
On a broader scale, like oh my god, you got an ulcer, must be super stressed. In Uganda, it's correlated with not eating.
Yeah.
Like you better eat or you'll get ulcers, right? Then eventually, as you grow older and you start suffering from these issues, they tell you no. Like, I remember the first time I got diagnosed with something like ulcers. They told me you have a bacterial infection.
Okay.
H. pylori, you have the infection. And I think the guy, like, from what I understood, he said, you have an infection, and this infection is what makes you prone to getting ulcers. I was like, cool story, cool beans. I finished my medication. I got better, right? But then somewhere along the line, I don't remember what fad we were following or what diet we were following. Like, in uni, I did very many stupid things. There was a time when we allowed ourselves 45 minutes in a day to eat out of 24 hours.
Strictly.
Wow.
Yes, we're doing very advanced intermittent fasting.
We were like, mind you, we used to drink.
Oh.
So we were like,
Oh, so you could still drink, but not.
no, now, but also you
Eat.
see with drinking, we said which alcohol has the fewest calories. Only drinking tequila straight.
Okay, good.
Damn.
There was nothing healthier.
We're eating 1 meal a day. What is the 1 meal? Matoke, greens, peas.
Was it that Olympia meal?
Sorry?
That Olympia meal?
Yeah, it was in hostel.
Yeah.
So I can tell you it worked. It was very unhealthy.
What was the goal?
We just wanted to lose weight. We
Okay.
lost a bunch of weight. It was very unhealthy, very unsustainable.
Yeah.
But we were combining a bunch of fads. Like, there was intermittent fasting with a bit of like keto in there, with a bit of like, so like keto will tell you this alcohol has this amount of sugar, this alcohol.
Yeah.
So they tell you the most low-calorie alcohols are champagne, tequila. We're uni students, we can't afford champagne.
Yeah.
Yeah,
We're gonna
tequila
drink
was
tequila.
somehow those days, man.
Men were willing to buy tequila.
Fair enough.
We drink tequila. I can tell you I suffered. But then at that point in time, they didn't tell me I had a bacterial infection. So I was like, if I've been told the bacterial infection is what leads me to get ulcers, so why are they telling me right now I have ulcers? Like, what's the correlation? Yes, I know that I'm not eating sufficiently and my habits are very poor. But like, if I don't have an infection right now, why am I more prone? Something like that.
More prone to the
ulcers?
Okay, yeah.
Yeah.
Okay.
Interesting.
So I feel like there was a lot going on
Yeah.
Yeah.
at that time. So I don't know if you can attribute it to just one thing. Lack of eating sufficiently, yes, will cause ulcers. Because ulcers so different reasons you can get ulcers. One can be from not eating. That's because of like a buildup of acid in your stomach. So you produce acid in your stomach to break down food. If there's no food, it's going to break down the contents of your stomach or the linings of your stomach. So not eating for long periods of time can cause those, and they call them, those actually call those stress ulcers. So that's one thing. Alcohol can cause inflammation of your gut as well, which can also lead to ulcers. So that's another thing. H. pylori, it's a bacteria. I wouldn't call it a bacterial infection, but it's a bacteria that can colonize your gut, as in it's present in your gut. It's different to a bacterial infection because it hasn't entered your bloodstream necessarily. It's just present in the lining of your gut, and it produces toxins that can cause ulcers, but also that can cause, I don't know if this was something that's widely known, but it can also cause cancer.
Oh yes, I've heard of
which
that.
is
H.
which is
pylori?
another
Yeah.
H. pylori.
Is it?
Which is why it's a big thing, and people want, like, when you find that you have H. pylori, you can just be like, oh, I have H. pylori, I'm gonna
Let me
go.
chill, yeah.
They want you to treat it and to treat it with antibiotics, because if you have a long-term colonization with H. pylori, that's also been associated with a type of cancer. So it's duodenal cancer. It's like the lower part of
Colon.
Your intestine.
first part of your colon, of your intestines, of your small intestines.
Yeah.
Ileum.
So
There's the ileum and the duodenum. She said the duodenum.
duodenum.
I don't know, man.
After your stomach. It's the part after your stomach. So it can also cause ulcers. So I think you had 3 potential reasons why you could have had ulcers.
Doing everything
You're
possible.
doing
to
all
have
the
ulcers.
things. And H. pylori is very common, as you said, because of things like badly prepared food.
Yeah.
And it's a gut contaminant that can be passed on from different people. So if someone, I don't know, has it colonized on their hand, let's say they didn't wash their hands properly, they prepare your food, you're taking that food, it's in your stomach. And
So
that's
H.
why it's so
pylori is not
easily-
like a bacteria that just is naturally in our gut.
It should not be there.
I thought it was native. That's
No.
interesting.
So does
Also,
that.
I think. So you saying that also it's not really detectable in the blood, like it doesn't. You can't call it an infection because it's not really in your bloodstream.
It's not it's not like a bacterial infection that's in your bloodstream.
Also,
So if you
that's
check
why
your blood,
like they do
it
the
won't
stool
go.
test as
Yes.
opposed to the blood test.
Yes.
Oh, interesting.
Yeah, but then
Interesting.
all the times that I had, because there was a year where I was getting this H. pylori infection so often.
years.
A couple of years,
Uh-huh.
maybe like 3 years. Yeah. They would do a blood test. They would like take blood from me, and then they would tell me I had a bacterial infection. So was it not H. pylori?
No.
Probably not.
No. H. pylori they'll get from a stool test, or they would get from they do a breast test sometimes, but they don't do that as often. Or if they do a camera test, where they put a camera into your stomach, they can take a
It's
test.
the colonoscopy, is it?
No, the
Uh,
colonoscopy is from down.
It's the other way around.
Yeah.
What is it called? Endoscopy.
Endoscopy.
Ah, okay, okay.
But yeah. Or GD.
So you were fighting more bacteria at once.
It seems.
Yeah, so the bacterial infection they found in your, so it's very, very rare for H. pylori to now go into your bloodstream. It's usually just in your gut.
Interesting.
Yeah.
So I had that. I kept having bacterial infections for a long time.
Yeah.
Right? The last time I had H. pylori, after I had it, someone recommended these supplements. I forgot what they're called. How have I forgotten?
Mastica.
Yes, Mastica supplements.
What's that? Like a probiotic?
Yeah, it is a probiotic.
Okay.
And I took those for a while, and now I've not had any bacterial infections in a long time.
Okay.
So What are those? Like, how do those work? How do
Probiotics.
probiotics work?
So they're healthy bacteria
Okay.
in your gut. So they're also all the gut bacteria in your gut will be producing different things. So H. pylori will produce toxins that will cause ulcers. The probiotics will produce things to counteract that. Not specifically counteract the H. pylori, but maybe to counteract the amount of acid that your stomach is producing, calm things down a bit, and just create a more healthy environment in your stomach so that other bacteria like H. pylori don't grow.
Thrive. Okay.
Yeah.
Okay.
Interesting.
Got it.
What was I going to say? I've forgotten. But I have a question related to what we're talking about and also what you said. Is there a bad weight loss?
Is that
That's
what?
the first
Is that
one.
bad weight loss?
Yeah.
Yes.
Because you said you were trying
absolutely.
to lose weight by eating once a day.
No, I
and-
just said it worked though. It wasn't sustainable because when I fell sick and I was on medication, you have to eat before you take the meds.
Yeah.
Right? So it just was not sustainable. Like I could not live my life. Even my energy levels. Promise you, if you're eating like an ant, you'll have. Actually, ants are strong. I wasn't as strong as an ant.
Yeah.
I was hella weak, and it was not sustainable at all. So eventually, I gained all the weight back. And I think also that ties in because like a bunch of people asked what like you think about intermittent fasting. If it's a healthy practice, like for life in general or for weight loss, if you'd recommend it. I don't know. I think we push things to extreme because in uni, your brain is not really all the way on, kind of. But yeah.
Yeah. So my question would be: is there, like, of course, that's bad weight loss, but ideally, you're supposed to lose weight if your weight is more. Like, you go for a BMI test, they tell you, man.
But hasn't
Yeah,
BMI
well,
been disproven though?
I think. Well, I mean, Dr.
BMI,
Amanda will
not
tell us.
disproven. I think
Okay,
there's
yeah,
a
but
role for
like-
BMI, but
Yeah.
in context of other things. So
Yeah,
if you're
like-
someone that's very muscular, for example,
it
your
doesn't take
BMI is going to
into
be
consideration certain
A
things.
bunch
that
of
you
there's
have
things.
to
something
I
it
know
doesn't take
about
into
waist.
consideration.
What?
Waist circumference.
Yeah.
So waist to height circumference is a more sensitive test for obesity than BMI because you can have high BMI, but actually you're mostly muscle and you're not doing so badly.
Who is
Knowing
the
your
waist?
muscle percent, like fat percentage, also is really important. Muscle mass is important. So there are different kind of markers to think of rather than just your BMI on its own.
I know,
But it's
I
a
know.
good like guide, yeah. Because
Yeah.
if your BMI is over 30, regardless of how muscular you are, that's probably not okay. So it's a guide. So I know if you're very underweight, then you know, okay, I'm very underweight. That's
How
also
about
a
like
problem.
body age? Is it a thing?
Body?
Body age. Like we've gone for tests where they
Like
tell
your
you,
physiological age versus
Yeah.
your biological age.
Yeah.
It's a marker. So it will take into account all these different things, like how strong are your bones, how strong, like how healthy is your muscle, how much fat do you have. So it takes into account all of these markers, and it comes up with a number based on comparing what according to your age, what you should be, and then where you are, and that gives you your physiological age. So your physiological age could be younger than your actual age because you've taken such good care of yourself and the parameters are all great. But your physiological age could also be like 60 and you're 30, which means that
There's a
actually
number
you're
they told
aging your
me.
body a lot faster
Yeah.
than you should be.
The time I went for one of those tests, there's a number they told me, man.
Of your age.
Mm.
How old are you?
How old are you?
How?
Then I was like 24,
Uh-huh.
and they told me 35. I was like, wait.
Mad. Mad.
Then the guy who went after me was also 24, and they told him 76. I was like, maybe.
That's 76.
Maybe.
He's knocking on the door.
It's not
No,
76.
And I can get all those tests done here.
At
You can get them done at Revive.
Revive.
All the tests you just
Plug.
Revive Wellness.
said.
You can get them done at
Crazy.
Revive Wellness. So we actually have a body composition analyzer.
Nice.
So it's something that you sit on. It's like an infrared monitor. So it's not 100% accurate, but it will give you a guide to say that your muscle mass is this amount, your fat percentage is this amount, your body mass index is this amount. We can measure your waist circumference as well, your weight, and then it gives you a physiological age. And the reason I say it's not 100% because it's not 100%. We're not doing invasive tests. It's a non-invasive test, so there'll be a small margin of error. But what I find it useful for is tracking. So you can say, okay, today I'm 78. In 3 months' time, I want to reduce my physiological age down to 50. and it can help you track that using those different parameters.
I need to do that again, man.
Yeah, I'm actually down.
I might
Can we
still
go do that.
Yeah.
Okay,
Yeah,
let's go
come
do
do
that.
We can go do that.
We can
But I also want I want to look at my results first.
in private.
Okay.
Yeah, I agree.
Because if that thing is beyond 35
We'll read
now,
the results on the pod. If
but
the
I want to look at them first and prepare
If the pod
myself.
is paying, then we'll read the results
The
on the
pod
pod.
activity.
I'm paying for my
It's for
own.
content.
I mean, should it or you know?
No,
what?
but you need someone to be accountable.
Yeah, I was
Yeah.
going to
Yeah,
say,
not-
should it
not all
become
of them.
Should it become like a challenge?
Not to. Not
Only for
thousands
the
of people.
patrons. Should
Only the
become a
patrons,
challenge
maybe.
Where we say like, let's say if you find out today you're 56, like okay, this is end of first quarter. I'm giving myself to like end of third quarter to at least be 37.
Yeah.
Yeah.
I like that.
Yeah.
I like
Yeah.
that. I
Let's
really
go.
don't mind that. We can do that.
So
Yeah.
so what do you think? I think this brings me to like two things, and
Yeah.
I want to phrase them like this because it will help. It will get like 4 questions that were asked.
Okay.
I think first of all, it's an intermittent fasting thing if
Yeah.
done properly. The second thing would be because you've spoken about the Mastica supplements. Somebody asked, with supplements, when am I supposed to stop?
Yeah.
Like, do I finish
Okay.
the teen? Do I take supplements till I die?
Yeah.
Like,
Yeah.
when is the end goal?
Do I
Like,
take it when I feel like now my stomach is acting funny?
yeah. Is it like
is
medicine?
that-
Do
is
I
that-
need a prescription?
Yeah.
Like,
okay.
For supplements,
And also
they said
supplements is a
and
lot.
vitamins.
It's not just like stomach.
But
Yeah.
there
Does
that
are a
make
lot of
sense?
different
Yeah.
supplements, yeah.
Yeah.
Yeah. So they're like, is it like what is the recommended? Like, do I require dosage, a prescription? Yeah.
Okay. So, okay, I'll answer the intermittent fasting first. Intermittent fasting is can be a very good way to lose weight, but also just to maintain a healthy lifestyle. So, depending on the type of intermittent fasting you do, there are different levels. So, you can do a 16-8. So, that's fasting for 16 hours a day, eating for 8. You can do slightly longer fast, so like 18 hours. I think the idea is to regulate your blood glucose levels, right? Your blood sugar levels. And that's why it's particularly good for people who are diabetic, pre-diabetic, because they're not overloading, you're not putting your body under pressure to produce insulin. So just for context, your body absorbs glucose or processes glucose using insulin. Insulin is produced by your pancreas. In diabetes, so there's 2 types of diabetes. There's type 1 diabetes where your pancreas can't produce insulin. So you're born, your pancreas can't produce insulin sufficiently, and that's called type 1 diabetes. So that's failure of your liver itself to do that. And that's why people go on to insulin at a young age. Type 2 diabetes, that's usually over time, where your body has been producing so much insulin, your pancreas has been producing so much insulin that it starts to get tired. And then you can't produce it anymore, and your body's producing insufficient amount of insulin to absorb the glucose that goes into your blood, and then you get your blood sugar levels remain high. So you have high blood sugar for a long period of time. That's one type of type 2 diabetes. Another type is when you have insulin resistance. So your body or your body uses the glucose in different ways. Your body organs uses glucose in different ways. So if you have high blood sugar levels, your body will then use that blood sugar for different activities. So your liver will absorb it for something, your muscles would absorb it to like act. But if you have a lot of fat around those organs, then your body can't absorb that glucose properly. So then that glucose stays in your blood and you have high blood sugar, and that causes damage to different parts of your body. So that's just a background of what diabetes, the 2 types of diabetes are. So that's why I'm talking about glucose regulation. So with intermittent fasting, what your body does is reduces the amount of insulin that your body has to produce because you're fasting for periods of time. So instead of just eating throughout the day all the time, when your body is just continuously producing insulin to try and like absorb that glucose, you're giving your pancreas a rest for 16 hours, which is not a bad thing. It's a good thing because then you don't get that insulin resistance or like the fatigue of insulin being produced too much. So that's one way that intermittent fasting can be really good. And if you have pre-diabetes, that's also really good because it can reverse that pre-diabetes because you're not overworking your pancreas. It also helps with so I don't want to get too technical. How do I describe it? So let me say mitochondria.
We know what that is.
You know that one? Okay.
Hey, what is it?
That kind of jam that's like a shoe. Okay, it's not a jam. It's not a jam. It's not a jam.
Yeah.
It's not a jam.
Organism.
But it's shaped like a shoe, right? That come on.
It's that one. That one deals with producing energy. It's the
It's
energy
inside that one.
producing organism of the body, right?
Okay.
So that uses glucose. But sometimes when you have metabolic issues, your mitochondria don't work very well. So when you're intermittent fasting, you get something where basically your mitochondria, the damaged ones, die, and you can form new ones. So the longer you fast, the faster or more frequent that process happens. So you're helping your metabolism. Basically, what I'm saying is intermittent fasting is good if done properly. Not for 45 minutes.
23-1, man.
Yeah.
not 23-1. Not 23-1. Not
So imagine fasting,
24.
because
But-
sometimes she fasts.
Yeah.
So fasting.
Fasting.
As in if I say I'm like a
Lent.
7-day fast,
Yeah.
water fast. How long do you do?
It depends on the fast, but like for like spiritual reasons.
Yeah.
Oh, like usually I fast, like I eat like in the evening from like 6
No, I mean the ones where you don't eat.
at all.
Yeah.
Or like the longest I've done,
Yeah.
3 days.
With nothing.
Just
Relax,
water.
relax. It's only 3 days and then my life resumes back to normal.
Yeah, but like in those 3 days, like nothing.
No eating.
Yeah.
Would that have the same effect?
Yes.
Okay.
It would, but it also then can potentially have other effects. So
but I
usually-
don't do it often. Like
Yeah.
I've never done it twice in 1 week.
But you drink water.
There's a time when I didn't drink water, but now that I'm migraine prone, I don't have that luxury.
But I think there's a decent part of our audience that fasts for spiritual reasons.
Yeah.
No eating, just
Yeah.
fasting.
For
Yeah.
how long?
For how long?
I mean the usual, because
yeah.
that it's a type of fast in the Bible. It's called an Esther fast.
Esther.
Yeah,
Okay.
and in the Bible, she didn't eat or drink anything for 3 days and 3 nights. But with my migraines can't let me go 2-3 hours without water. Like they're like, bro, you're joking. But usually now a bunch of people, especially not like right now, we're in Lent and we're in
Yeah.
Ramadan as well.
Yeah.
I know that Muslims, it's about a 13-hour window from like sunrise to sunset.
Yeah.
13-hour window. For Christians, there's some that will, like, let's say eat today, evening, like 6 to like 8, or just in the evening they'll have whatever meals they're able to, because also, within a 4-hour window there's only so much,
There's
you
so
can
much
eat.
you can eat. Yeah.
And then they go to sleep and the fast starts again. So that's like
Yeah.
24.
Yeah. And I think your body will adapt to it, especially if you do it over a long period of time. And I know for religious reasons, people have been doing that for a long time. We haven't found any like major health issues that come with fasting. And actually, there are a lot of health benefits that come with fasting if it's done in the right way. Prolonged periods of fasting with no water, no food can cause some health issues. So at some point, your body will need some energy to function. And what it will start doing is first breaking down fat, but then you might also start breaking down muscle after some time. And that's obviously not very healthy. So you'll start losing muscle mass, which isn't good. And that's part of that unhealthy weight loss that you're asking about. So healthy weight loss is when you're losing fat, building muscle. Unhealthy weight loss is that you might be losing some fat, but actually you start breaking down your muscle, and that can be very dangerous for you because of your bone health, many reasons. So you don't want to go prolonged periods of time, because then your body goes into starvation. You might start having issues with electrolytes and things that are supposed to be very balanced in your body. So for prolonged periods of time, as in days or weeks of not eating sufficiently or drinking sufficiently, you're not just fasting, you're now going into starvation mode, where your body is using different parts to get energy, which isn't good. I think 3 days is probably okay. But I think anything much more than that, like a week, couple of weeks, can be very dangerous.
Quick question: is low blood sugar also diabetes?
Low blood sugar is
Hypoglycemia.
hypoglycemia. So
Yo.
It can happen in diabetics. She's been reading.
You guys are plumbing
She's
this
been
sport.
reading.
Like we've been saying, we needed a doctor. Kumbe the whole time.
I was wondering.
Guys had all this information.
Our
And they were
science is
just
not
waiting to
backed
flex.
up.
No, but then,
Say less,
but
say
then
less.
though, listen,
less.
there
Yeah.
are a bunch of things. I can't tell you how many times I've had the word
Yeah.
hypoglycemia.
Okay.
Like every time, like you're watching a show or a movie, or somebody's like, she needs like a snack. She needs like she can easily get hypoglycemic. Da, da, da. Doesn't this stuff stick in your head?
Not at all.
Yeah.
Not even the slightest.
No, you don't watch enough Grey's Anatomy.
Not
I don't watch
Is it
Grey's
called the
Anatomy.
house?
Yeah,
Oh,
I
yes,
don't be
I
paying
watch
attention
House.
to what they're actually saying.
You're here for the emotions.
I'm like, oh my god, this person is sick.
That's
And they're
what
about
you're
to
here
die.
for.
And then how saves them.
Yeah. And then there's a
Sorry,
bomb in the
doctor.
theater.
yeah, and some nice music as well.
Yeah.
Sorry, go ahead,
So
doctor.
hypoglycemia can happen in diabetics. That's usually related to their medication. So they'll be on medication to lower their blood sugar, but if for some reason they're not eating sufficiently, you can go too low. Insulin can cause hypoglycemia. So there are a lot of, so that's in diabetics, you can have hypoglycemia, but that's usually related to the medication that they're taking for their diabetes. Otherwise, hypoglycemia can happen if you're just not eating enough. And that's the other reason.
Fair enough.
Yeah.
Personally, I like taking sugar, like sometimes a lot.
You like sugar?
Yeah, I like sugar. So I'm like, am I at a risk of getting diabetes? Should I go like have a check? Like, should I be checking myself for diabetes or something?
You should always check. That's my
Advice.
My-
And I know the blood sugar test is
idea.
also quite quick.
It's quite, so the finger prick test will give you a quick answer, but it tells you what your blood sugar is right now. That's a random blood sugar. So depending on the last time you ate, it might be slightly higher if you've just woken up. The best one to do is an early morning blood sugar when you're fasted. So if you haven't eaten for
Or
at least
like
12
through
hours.
the night.
Yes, you fasted through a night, take an early morning blood sugar, and that gives you an idea of what your fasting blood sugar is, and that it's a marker of whether you are diabetic or not. But there are different types of markers. You can also do a glucose, like a challenge. So you give yourself some glucose, and then you see what your tolerance is to glucose, how high your glucose levels go after you've eaten something, for example.
But glucose, the one in that blue box.
Glucose. Huh?
What is it?
Oh, like what glucose you take?
Yeah.
They give you. they'll give you a control
Any
amount
type
of
of
glucose and
sugar.
see how your body
Could it
reacts
be any
to
type of sugar?
It has to be controlled. It has to be like a certain amount of sugar that they
okay.
give you.
Glucose in that
But the best one to do, so it's something called an HbA1c, and that basically shows you how much glucose how your blood sugar has been over the last 120 days. So it's like an average. So I think that's the most sensitive one, because it's not just telling you right now, today, what's happening. It's telling you what you've been like for the last couple of months.
So I have to test every day for 120 days?
No. You test it once, but it's a marker of 120 days
Also,
ago.
it can.
Okay.
Interesting.
It's an average of the last 120
Technology
days.
is nice. I won't lie.
Technology is so cool.
Yeah.
So that's the one I would advise. If someone wants to do a screening, that's probably, it's a bit more expensive, but that's like the gold standard one. Otherwise, you can do an early morning like fasting glucose that also gives you an idea, and then also you can also do the glucose tolerance test as well. But back to your question, so if someone told you they're diabetic, maybe it's a bit of stereotyping, but what do you think they look like? What do you think their physique is? What do you think is a certain physique of a diabetic person?
I've seen enough of them to know it's normal. Like they all
For
look
me,
normal to
it
me.
depends
Yeah.
on the age. Usually, if it's somebody if it's a child, they usually look normal. Like they're like either they could even be extremely skinny, and they assume it's I think type 1 or something like
Yeah.
that. Yeah, they assume it's type 1. But then if also it's like somebody where your foot is falling off, as in
No, your foot is actually falling off.
it's actually
Those
falling
wounds
off.
that don't heal.
Yeah.
Mind you, they're telling you have to eat a certain type of way. Your foot is falling off.
Let me ask. If you met someone whose foot was falling off, would you ask, are you diabetic?
No, listen. I mean,
They could also be a smoker. That's the other thing.
oh,
Or both.
Or like
no, I
elephantiasis.
forget, living in a vacuum is crazy.
I
I
don't.
forget guys are smoking. Like in my mind, smoking is something so optional that I'm like, what do you mean you can't just stop? As in, why do you smoke? So I
Yeah.
don't.
Bro.
My mind
It's
doesn't
tough.
register it as a real
Hard.
thing.
Yeah.
Yeah.
it is.
Yeah, but like I'd automatically assume, because growing up, I don't know why I knew this, because I don't really know people that have diabetes in my family.
Yeah.
Don't have, But I've always known that diabetes is associated with you losing your extremities. Like, if you're
It can
not,
be.
yeah, if you're not
It
taking
can
your
be,
meds and
yeah.
you're still eating a certain type of way, you're not taking care of
Yeah.
yourself, you can lose a foot or two.
Yeah.
Or
Yeah.
2 is crazy. Like, you're saying like we have 5 feet.
No, but but you can actually lose a foot or
1
two.
or 2 feet.
Yeah. Or like fingers, or that's what I've always known. And if it's like, I mean, like I've seen cases of like extremely big people that do not have a single thing.
Yeah.
And I think it's funny that in Uganda, or even in Luganda, in Uganda, we call diabetes sugar, right?
Yeah.
Sukari. So it's associated with, I think, the natural inclination would be, oh, you eat lots of sugar and lots of
Food.
junk food and whatnot.
Yeah.
We oversimplify it. We don't start thinking about insulin levels and whatnot. But yeah, I don't think it's as automatic as that, because I've seen bigger people that have it, and then I've seen smaller people. I know a lady, she's in her 60s, quite slender.
Yeah.
She was diagnosed in her 40s. She still has it, but she manages her life very well. Like, gosh, it's her diet is very, very disciplined. So I don't know. For me, I don't think it's obvious these days.
And it's not actually, and that was
That's
the
the
was the
point.
point I was trying to make. So usually
When you lose your food, or they cut it
they
off.
cut it off.
Yeah. Like it.
They cut off
Amputee.
whatever is unhealthy.
Yeah.
They
Can
cut
also
off
your
cut it
finger.
off.
Looking like a
No.
leper is too funny.
I remember what leprosy like. I remember like photos of leprosy.
I've
Didn't
actually
necessarily
never seen
look
that.
like-
Bible, what?
Not from the Bible, bro.
Which
Like,
Bible has
Leprosy in
photos?
modern times.
Which Bible has
No.
photos?
Has there been leprosy in modern times?
yeah.
There's
Have you
some
had
real
though?
leprosy.
Not even modern times, but like in like the 19 like World War times and
Yeah.
whatnot.
Yeah.
There were instances of leprosy. So like certain, it's like almost like they created colonies. Like there are certain areas where they would go and like dump
Yes.
people
Yeah.
Okay.
that have been infected.
Crazy.
Yeah.
True.
Yeah, so if you see people that have survived, it doesn't necessarily look like amputation though.
Yeah,
No.
it's
So with leprosy, you basically you lose sensation. So you'll get burnt. You just lose sensation in your extremities, and it can travel. So then, that's why people lose their fingers, because they'll like leave their hand here on a stove or whatever, and they won't know, or they'll get injured and they don't know, and that's why leprosy is such a like. Yeah.
As you're putting your hand in a stove and you forget it.
Yeah, you're
You
not
can't feel
feeling
anything.
it.
You can't feel anything.
Sorry.
But yeah,
what
but
were
sorry,
you-
what I was trying
Yeah.
to say before we go to leprosy,
Diabetics.
what I was trying to say, like there's no, so it was basically what you said, like there's no look of diabetes. I think most people would think, oh, because you eat a lot of sugar, carbohydrates, you'd be fat, etc., which is what overweight, what typically used to be the idea of like a type 2 diabetic, so poor lifestyle, larger, but you can have a very slim person who's also diabetic, and you call it like it's lean diabetes. But what you might find is that they're slim or appear to be slim, but they have a lot of fat around their organs, which means
Is
that
that
they're
Like it's localized around the
visceral
organs.
fat.
Yeah,
Yeah,
visceral
visceral
fat.
fat. She's an actual doctor.
Not at
Um,
all. This week I
this
learned
week?
the difference about subcutaneous fat
Yes,
and visceral fat.
fat.
Visceral
That's
fat is
it.
done around your
Yeah.
organs, while
Yes.
subcutaneous is the one like under
Yeah.
your skin.
Yes, and
DJ
having a lot of
McKean,
Guys, give me that
Introduction
MT,
to
bro.
Biology. That one I know it.
Dr. Casper, today. From today onwards.
Yeah, subcutaneous fat. Yeah.
subcutaneous fat. So subcutaneous fat is the one you can see
Yeah.
under your skin. Visceral fat is the one around, like the silent fat around the organs. That's also causing some trouble. So yeah,
Apparently it's the killer.
Visceral.
visceral
Yeah.
fat. Yeah.
Subcutaneous will just be a chilling.
Yeah.
Yeah.
But the
But it's
the
also not
visceral
good.
is- Yeah,
It's
it's,
also
not
not
good.
good.
Yeah.
But
It's also
the
not
visceral
good. But
one
the
is the
visceral fat is
silent
the bad
killer.
one. Yeah.
Because you don't look unwell, but you
Yeah.
are unwell.
And I can screen for that also.
For visceral fat,
Yeah.
that one's slightly harder to screen for,
Okay.
but you can screen for pre-diabetes, diabetes.
Is visceral fat also the one that like blocks blood vessels?
No,
What's that one?
that's
Is it block or like compresses them? Something like that.
not compressed. So you have a buildup of fat within the blood vessels. That's from high cholesterol. So that's slightly different.
Okay.
And so like the blood vessels are showing you. So if you have any abnormalities of your blood vessels, so if you have high blood pressure, if you have diabetes, that also damages the blood vessels. And then cholesterol that's going through, like usual cholesterol that's just going through your body. If it's in high amounts, you sometimes get cholesterol deposits within the blood vessel. So if it collects, it just makes it narrower and narrower and narrower. And then it causes something called plaque. So we call it plaque the more it builds up. And then the way you get heart attacks is if that plaque ruptures and causes a clot, then the whole vessel clots and you lose blood supply to that part of your heart. And that's a heart attack.
That just man.
Is it like the plaque on teeth?
I mean, not the same one, but
It's similar.
Same family.
You can
Same name.
compare
It
it.
just sounds scary, man. If you see me in the gym tomorrow for like 4 hours,
Yeah.
Or just sprint up the stairs for
for every hour.
every hour.
Fair enough.
1 minute every hour.
1 minute every hour.
Crazy.
If you guys ever see me in the gym again,
You'll be
that's not my home
sprinting
sprint.
every hour, like 6:01. Time to sprint till 6:02.
Listen, I feel like we're not going to stop asking the doctor questions.
know.
Yeah.
And I feel like we've maybe done a bit too long. How long have we done?
We have done a bit, but then remember we took a break.
Okay.
But then,
Oh, we did.
Okay.
at the end of the
Done
day,
an hour only?
I've done 2 hours.
Okay.
at the end of the
I
day,
think that's enough for this episode.
This episode.
We'll have the doctor
yeah.
on another time.
it should visit Revive.
Yeah, honestly.
Like,
We are going to screen. We'll bring you guys the results.
Yeah.
I'm not telling 2,000
Live screening.
people.
Live screening
Live.
coming
In
soon.
fact, we shall come
Live
without camera.
screening coming soon.
I'm not telling 2,000 people what's going on with my body now.
We'll charge.
pay-
Don't
Or
worry.
you can do it and then reveal later.
Aha.
When we
How
are
about
now
that?
better.
When you're better.
Yeah,
when you're
I
younger
like that.
and
I like that.
healthier.
Tell guys, by the way, last year
You guys
I
last
was
year
70, man.
Now I'm 26. Okay, but you can be younger than your
You
actual
can be
age.
younger than your
Yeah.
Guys,
One of the ladies I tested with, she was 28 and like her physical age was 19.
19.
Dope.
Imagine.
That's dope. Yeah, that's dope.
Can someone just leave? Like, can I like leave? Can
That's
I
where you
be-
go wrong.
You have to know how you're living.
Yeah.
No, you don't want to be surprised.
by
That's
how
my
I'm
thing.
living?
Yeah. No, you don't want to be surprised by something that you could have caught earlier.
Yeah.
Yeah.
That's
So
true.
It
screen.
doesn't stop you from living.
That's
It
true.
might help you live better.
I think
Yeah.
it ties back to what you said earlier. It's such a Ugandan thing for us. Prevention is not a thing for us.
Yeah.
Yeah.
Cure is a thing for us.
Yeah.
Surviving is a thing for us. Like
Yeah.
ordinarily, when you're okay in quotes, when you feel fine, there's no single thing in your mind that's telling you go get checked out. For what? I'm fine.
Yeah.
Yeah.
So I think that's the moral of the story. Prevention is better than cure.
For sure.
Absolutely.
Yeah.
Yeah.
And what
man.
happens if I don't know what to check for?
You can come to Revive and we'll tell you.
Fair enough.
We will guide
Yeah.
you.
Okay. Do you have any parting words? Maybe I don't know where people can find you. Any stuff that's happening at Revive soon?
Yeah.
Anything along those lines?
Okay, so Revive is located in Kololo, Lower Kololo, on Dundas Road, opposite Kololo Courts Hotel. So they mentioned we're a clinic and a studio. So we can do your health checks, but we can also host yoga classes, Pilates classes, mindful meditation, things that we're doing now. So a couple of events we do every month. So we have a yoga and chat coming up this weekend on Saturday. So that's a yoga class followed by a mindfulness class, followed by a chat with different health professionals about different health issues. So similar to what we've done here, but just with more of me, so I'm not getting all the questions.
Fair enough.
So it's a variety of questions you can come and ask, and also really good plant-based healthy food. And then we have a run and chat with Aka Run Club. So same thing, we do a 5K run, and then we have a chat about different health issues. So it's really a platform for you to come, learn, meet people, build a community, do some helpful, productive activities, and have a good time and be healthy.
Nice. I feel like
Okay,
we'll
I
link
like
all of
that.
those things in the
Yeah.
description.
Yeah.
Thank you so much for coming on the pod
Thank
again.
you. Thanks for having me.
Yeah, clearly
was
you must come
fun.
again because
We've only answered two
Very
questions. Two.
bruh, we
Listen.
did not get into so many things.
Very insightful question.
Yeah.
I mean,
Yeah.
conversation, I
Yeah.
feel.
Next
Yeah.
time I'll be better read.
You've seen
You've
what
what
There's
guys
an
are
agenda here.
Mm.
Between these
And I
two,
were
they
planning.
came-
We have a
yeah,
different
I
group.
noticed. Guys were a bit quiet actually on a group this week.
They're studying.
Now that I think about it,
The whole weekend.
okay,
That's not a
okay.
lie.
Got it. Yeah, so
Now you know.
thank you so much for coming on.
Thank you. Thank you, guys.
We wish you all the best.
Thank you so much.
And we're excited to see what you guys do next with Revive and with all the projects. Yeah.
Yeah, and thank you for making this platform for your viewers. And yeah, if they want more, I'm happy to come back.
Nice.
Yeah.
Okay. Until next week, I can't say it on. I forgot it.
But not okay. Until next week.
Yeah.
I don't know about that one, but don't forget to touch grass, guys.
And screen.
Touch
And
grass,
screen.
be present.
Yeah.
Go for screening, man. That's why legitimately going to go for screening. I won't hold you. 'Cause
I
I've
won't
never
lie.
gone for screening
We
in my life.
are something that should I say it? We might not be safe if I say it. My friends and I now do a thing where, because I walk a lot in my neighborhood, my friend walks a lot in her neighborhood. We're tired of our neighborhoods, so now we link up and we walk in other neighborhoods.
Interesting.
Yeah,
That's cool.
You guys use Google Maps, or because I don't know if either of you has good directions. You
First
and your
of
buddy.
all,
You and your buddy. I don't trust you.
Mm.
I don't you guys call me on
Neither
Melbourne.
do.
We are here close to.
They're just down from their home.
It's still Women's Month.
right?
My fault. My
Don't-
fault.
You need to
My
be
fault.
You
positive.
understand that?
I will cut that part out of the podcast. Out of respect.
So yeah, so I feel
Yeah.
like it, you know, because we're actually having that conversation, and she was saying, oh, there's so many things one start doing. She was telling me she wants to start doing Pilates, but then she was like, but if I start doing, then we started doing some you know, that meme of when you start calculating, like 3 Pilates classes a week would cost me times 4 weeks in a month, time divided by my leisure budget. Yeah, but sometimes just take a walk.
Yeah. I'm heavily thinking about that 5K run.
I'm
Been a
thinking
while.
about
Been
the
a while since
yoga.
I've done it.
Come through.
I
The
need to
5K
run.
run is free.
Yeah.
The chat's free.
I might run 10K.
Will they charge you to walk on the
Can't charge you
road?
to run. Exactly.
Yeah.
Yeah.
Okay, man.
Yeah,
All
man.
right.
Until next week, Africa must unite.
Bye.
Peace.